Book today in the Thom Hartmann Book Club is Stand Up, Struggle Forward by Sanyika Shakur. This is a book that was written back in the late 90s, but it's still very, very timely. This is from the second chapter titled Class Antagonisms Inside the Fundamental Contradiction of National Oppression. Having just passed the 19th and quickly approaching the 20th anniversary of the LA Rebellion, we should be reminded here of what Rodney King whimpered as he stood in front of a bank of microphones surrounded by class enemies and neo-colonial politicians. We should remember how he'd been dressed in that non-threatening cardigan sweater, white shirt, and black tie, how his hair had been tortured into submission by a jerry curl. We should reflect as well upon how timid and spooked he looked, and on how concerned and stern those who flanked him were as well. That was a Kodak moment. It was staged to foster an image of contrition and resignation, submission, a victim. Rodney King had been led to believe, through a bourgeois sense of reasoning, that the rebellion was really about him, that the reason new Africans and Mexicanos took to the streets of South Central was the result of his filmed beating. That, of course, is typical of mechanical bourgeois thinking. What it's not typical of, however, is someone from the hood. And this cuts both ways. No one in the hoods and barrios ever thought it was about Rodney King. We'd all seen the film over and over like everyone else, but that was par for the course. We'd always seen that, long before anybody caught it on tape. Actually, we'd experienced much more than that. Why, it's safe to say that the hoods had gone to war with each other in vicious waves of internal, intra-class combat for much less than that, though because of a general colonial mentality which prevents the challenging of bottom-up oppression, the same hood forces will not, in any systemic way, wage war on the pigs, or for freedom, land, and socialism. Rodney King alone and of his own accord would not have thought to hold a press conference to ask the asinine question in the form of a whimpering request, can't we just all get along? The fact of the matter is, we are getting along. New Africans and Mexicanos are getting along just fine. What we couldn't understand was why he was admonishing us for getting at the exploiters of our communities. The impression he gave, with his handler's hands up his back like a ventriloquist troll, was that a race riot was going on, as if we had all begun to kill each other or burn and rob each other's homes. His handlers compelled him to send up a false flag, a diversion. But you see, this was the very thing that exposed the class interests and reactionary politics of the Uncle Toms that had been designated to handle him, and by extension, us. Let's go back for a minute. Let's talk social development, aka history. There exists a fundamental contradiction in our lives that, like an elephant in the room, no one wants to acknowledge. As a consequence of the war waged upon various African nations by European powers, those of us captured and kidnapped were taken out of our own self-determining social developments and violently forced into Euro-American history. This is not simply a clever play on words. This is a reality. We lost the ability to control our own destiny. Read that again. From that time until now, the fundamental basic contradiction between the U.S. oppressor nation and our own oppressed and colonized nation has been the governing imperialist relationship, which is to say, us not being in control of the qualitative factors that determine our lives as a people, as a nation. Our tradition of struggle against this fundamental contradiction has taken many forms, some hidden or obscured, some open and hostile. But all of these have been open to resolve the fundamental contradiction and to regain our independence. While there have been some bona fide struggles to resolve the contradiction, there have also been reactionary neocolonial struggles waged by internal enemies loyal to the oppressor nation and culture that have tried time and time again to subvert and control our destiny for the benefit of the capitalists. They've come among us, always imposed from above, stirring up emotions and giving lip service to progress, equality, justice, and prosperity. These always within the colonial confines of the oppressor's arrangements, and none collectively ever materialize, because without a resolution of the fundamental contradiction, that is the freeing of our productive forces from U.S. imperialism and the governing of our own affairs, we'll remain a minority within the American system as opposed to a majority in our own, and subjected to the established bourgeois social contract, i.e. colonialism, neo and post. We can parade all through the empire with black congressmen, black mayors, black governors, black police chiefs, black Supreme Court justices, hell, even a black president. And absolutely nothing will alter the genocidal relationship that governs our national oppression here, because the blacks are part of the colonial apparatus. They have made a strategic alliance with the capitalist imperialists to act as go-betweens in our oppression and exploitation. This is a conscious class stand. The black petty bourgeois is not innocently confused, like, say, Mrs. Jackson across the street is, about our national oppression, about the existence and subjugation of New Africa. They are well-read, have traveled in our experience. They've just chosen sides against us and in favor of our historical enemies. And the sooner we recognize and internalize this, the better off we'll be. Black ain't nothing but a color. As a designation of our national identity, it has played out. It is a superficial understanding at best and a foolish and dangerous analysis at worst. We have no collective control over the qualitative factors which determine our lives. We do not, in other words, control our destiny, not as a people or a state. The book is Stand Up, Struggle Forward by Sanyika Shakur. We have a special video up over at thomhartmann.com for supporters of our program, and it's about how a letter that the IRS sent out to 3.9 million Americans saved 700 lives. And you're like, wait a minute, the IRS saved 700 lives? How did that happen? Well, it had to do with Obamacare, and it's a fascinating story. And it turns out that this analysis of this IRS mailing was actually the first time that the federal government has done a study that actually proved that people having access to health care produces fewer deaths. For every 1,648 people who got the letter, there was one fewer premature death. I'll explain the whole thing in the video. It's you know, as I said, it's available over at thomhartmann.com for people who are regular supporters of our program, and it is really worth checking out. And it's a great ad, essentially, for a national health care system.
This is the Thom Hartmann Program.
Well, happy Thursday. Sean says it's Tiny Friday. But there's a lot going on. The stock market is collapsing again, or continuing to. It's now dropped below 10%, below its high, which means that it's officially in what stock traders would call a correction. And of course, a correction is something we've been anticipating for quite a while. The stock market has been higher than actual economic activity and company profits would justify, in large part because companies have been using their giant tax rebates to buy back their stock. But the thing that's driving this is concern about the coronavirus and its impact on the U.S. economy, or on the economy all around the world. Because, I mean, now there are 150 different drugs sold in the United States that are exclusively manufactured in China, which is very concerning. It's one of the reasons I suggested the other day that you talk to your doctor about getting a 90-day supply if you take an essential medication. The guy who doubled the price of insulin when he was at Eli Lilly, Alex Azar, he's now our head of Health and Human Services, because Trump always puts lobbyists in charge of everything, right? And he was asked repeatedly yesterday before Congress, Jan Schakowsky was questioning him, when a vaccine is developed to deal with this, and of course large chunks of the funding for that are coming from your tax dollars and mine through the National Institutes of Health. When a vaccine is developed, can you guarantee us that it'll be affordable to everybody in the country? And he repeatedly said no, he wouldn't. He didn't want to interfere with the so-called free market. I mean, this is pretty crazy. The guy who is the acting head of the Department of Homeland Security, which used to have, before 2018, a division that looked at epidemiology and epidemic diseases. It was a position created by Barack Obama, but during his presidency, in response to the Ebola outbreak in Africa. That agency was shut down, and the guy in charge of it was fired by Trump in 2018, because after all, it was something Obama did. So the Department of Homeland Security literally doesn't even have a division that deals with this kind of stuff any longer. And Chad Wolf, who was the acting head, he was before Congress yesterday. And they said, do you know what the fatality rate is from this coronavirus? And he said, well, it appears to be a little, around 2%, a little above 2%, but we're guessing that it's actually lower than that because there's probably a lot of cases that are not being diagnosed, which is accurate, more or less. And then they said, so what's the mortality rate for the flu? And he said, it's about the same. It's around 2%. I'm sorry, that's wrong. The mortality rate for the flu is 0.1%, which means out of every 1,000 people who get the flu, 1 will die. But a 2% mortality rate for the coronavirus means out of every 100 people who get the coronavirus, 2 will die. Now just let that sink in. And the head of the Department of Homeland Security, who's charged with protecting us, doesn't know the difference between the flu and the coronavirus in public, under oath testimony yesterday before Congress. I think one of the reasons the markets are falling, and if you were looking at the future markets yesterday, well, Donald Trump was giving his BS press conference saying, oh, there's only 15 cases, which was a lie. The scientists just before him had said, we have 60 cases that we know of. And Trump, we only have 15 cases and they're all getting better. Pretty soon we're going to have none. Right. This guy has told 16,000 documented lies, documented by the Washington Post. The biggest lie that anybody could come up with, the one lie from the Barack Obama administration was if you like your health insurance company, you can keep it. And that was true, by the way, of 97% of people who moved to Obamacare. So it's not really a lie. But, the last lie that I remember a president telling in my lifetime that was a serious and consequential lie was when Lyndon Johnson said that we'd been attacked in the Gulf of Tonkin, or when George W. Bush and Dick Cheney said that Saddam Hussein had weapons of mass destruction. But, that was one lie for each. But here, there's 16,000 lies, and now he's lying about the coronavirus. There are reasons that we need to be legitimately concerned about this. There are health reasons, but more importantly, I think right now there are political reasons. And I'm going to talk about both the politics and the health of this, of this entire situation. There was a fellow down in Florida. His name was Osmel Martinez Aziu. And he was a businessman. He had come back from China. And he came down with the symptoms of a cold. He had a fever, he had a cough, he felt like crap. And he'd just been to China. So he goes to the hospital, he goes to his local hospital, to the ER, and he says, I might have the coronavirus. Because I just came back from China and I've got these symptoms. And so the doctors there tested him. Turned out he didn't have it, which was, a relief for everybody involved, and sent him home. And he was like, okay, cool. I'm, going to go home. He then gets a bill in the mail for $3,270 for the emergency room visit and the test. And the Washington Post reports today he's expecting even more bills to arrive over the next few weeks. Apparently, they haven't gone through all the items in the itemization. $3,270 to show up at the ER and say, I think I may have coronavirus, please test me. This is how screwed up and insane our healthcare system is. Because from the get-go, the whole Republican thing, remember when LBJ, well, you probably don't remember, most people watching are not old enough to remember, but in the 1960s, in 1965, 66, as LBJ was putting together Medicare, and Ronald Reagan was saying, if Medicare passes, we shall have moved into the era of socialized medicine, and America will no longer be a country where men are free. The Republicans were hysterical about Medicare. It's socialized medicine. Well, they're still hysterical about it. They're still trying to destroy it. So anyhow, LBJ wanted, and Robert Ball, the guy who actually wrote the Medicare bill, who wrote it in a way that a decade later it would be possible to just start lowering the age requirement and eventually have Medicare cover everybody in the country as a single-payer healthcare system. It was literally designed that way by LBJ and Hubert Humphrey and Robert Ball and Democratic members of Congress. Medicare was designed to be a national healthcare system within 10 years. But in any case, the Republicans said, you can't give people free medical care. They will abuse it. They're going to be living in the hospitals. So you've got to make people pay at least 20% of the bill. And so, they built this hole into Medicare where Medicare only covers 80% of your expenses. And what that did, of course, is it provided an opportunity for private health insurance companies to fill in that 20% hole. Those are called Medigap policies. But this was a result of this was the pound of flesh that Republicans extracted in exchange for, well, actually no Republicans voted for Medicare, but maybe conservative Democrats at the time, but whatever it was. We got the same thing with Obamacare. I mean, the Kaiser Family Foundation found that more than half of all people with health insurance to their employees have an annual deductible of at least $1,000. The average on Obamacare plans is $4,000, which means that the first $1,000, if you show up at the ER and say, I want to get tested for coronavirus, it's going to cost $3,000, $4,000. The hospital's going to bill your insurance company, and the insurance company is going to say to you, you have to pay the first $1,000. That's the way it is with Obamacare right now, which is as good as we've been able to get it. And then, Trump now is selling on the Obamacare exchanges these junk policies. They used to be limited to 90 days. Now they're up to 3 years, where the health insurance company, you don't like that $600 a month policy? How about this $300 a month policy? And the problem is that, if you get sick, seriously sick, like cancer or something, it'll only pay a couple $100,000 and then that's it. You have no more money, period. This is why we need Medicare for all. Nancy Pelosi tweeted out this morning, the Trump budget guts nearly $700 million from the Centers for Disease Control. At the same time, Republicans in Washington are suing before the Supreme Court to end Obamacare so that if you get sick with coronavirus and you show up in the hospital and the doctor says, your lungs are in really bad shape, you shouldn't have been smoking, your health insurance company will be able to say, no, we're not going to pay for any of this. That's a pre-existing condition. It gets even weirder. I mean, I'm going to hit a break here, and I want to, just fill you in on all this stuff. I mean, this is, if there ever was a case for Medicare for all, the way that Bernie Sanders is promoting it, and Elizabeth Warren, with no deductibles, no co-pays, everything's covered, like it is in every other developed country in the world, it's the coronavirus. I mean, who's going to spend $3,000 going to the hospital to get tested? And not only that, by the way, this guy in California tried to get tested. Stick around, I'll tell you about that.
This is the Thom Hartmann Program.
He tried to get tested and they turned him down because the CDC guidelines said, we'll only test people who've been to China. Seriously, stick around. And welcome back. Martin in Huntington Beach, California. Hey, Martin, what's on your mind today?
Oh, hello, Tom. Yeah, I just woke up this morning, and it popped in my head. What about the kids in the gulags down there? Is that a perfect breeding ground?
Oh, my God.
They're worried about this coronavirus.
Yeah, the kids in the cages.
Yeah, I mean,
oh my God.
They're like sardines, and it's unsanitary.
Yeah.
And somebody.
Flu is ripping through those things. Trump said that they wouldn't vaccinate the kids because he didn't want to pay for it. And now we've had several of these children die of flu in these concentration camps that we're running for refugees, from our southern border.
Yeah, exactly. I mean, they arrested the doctors when the doctors went down there to try to vaccinate them.
Yeah, you're right. That's astonishing. Yeah, this is This is getting weird. Martin, thank you for the call. Carol in Menneson, Pennsylvania. Hey, Carol, what's on your mind today?
Hi, Tom. Yeah, that man made a good point. I hadn't even thought of those poor children.
Yeah.
I was thinking of it. Well, we stocked up for 2 weeks, as you did. I understand.
Yeah.
I think it's always good to be aware of things, and because I think when you're doing something, you're less fearful because you're actually doing something constructive.
Yes.
Like I went and got my prescriptions filled for 90 days.
That's a good
things
idea.
like that. But
Yep.
my concern about this also has to do with the political landscape. I mean, I don't know about anyone else, but I'm not going to any rallies.
Yep.
Where there are thousands of people.
Yeah.
I mean,
Yeah,
wow.
I think a lot of this stuff is going to move out of stadiums and into the internet, and probably fairly quickly. Now that this one case in California where the guy had not traveled anywhere. He obviously caught it from somebody else in his community, and for 3 days he sat in the hospital saying, "I think I have coronavirus and I need to be tested." And they kept saying, "The CDC will not send us a test kit because you weren't in China."
Yeah.
This is crazy.
Well, we don't have any testing as the other countries do.
Right.
South Korea, all of them have these test kits.
Yeah, hundreds of thousands
we are
of
so
them.
far behind the curve on this that it's scary.
Yes. And it's because Trump fired all his public health officials, and he's defunded the CDC. He's defunded. I mean, it just goes on and on and on. I mean, the perfidy of this. I mean, it's extraordinary.
It's absurd. It's absurd. And he only did it because most of that was Obama's programs,
Yes.
Obama's programs.
Yes.
And he just can't tolerate anything, no matter how good for the country it is,
Well,
if
that
it
was-
has Obama's name on it.
Yeah, that was his excuse, but he was also being advised by the right-wing billionaires who run the think tanks that, the libertarian think tanks, that you just need to get government out of all these things because the free market will solve all problems. And if we could just, this Charles Sowers argument from a couple days ago, just get the government out of everything and the magical free market will magically solve everything. No.
Yeah, right. I'm sure that every one of us individually will be able to solve this program without the government, right?
Right. Like yes.
Have a good
exactly.
weekend, Tom.
Thank you very much, Carol. Just as Margaret Thatcher said, there is no such thing as society. There's only a collection of individuals. Right. I mean, this is the philosophy that's been driving neoliberalism in the United States and the United Kingdom for 40 years now. And look at what it's done to both of our countries. It has impoverished us. The rest of Europe is looking at the UK and saying, "Brexit, see you later, guys." Although there's not a shortage of neoliberals in the UK, in the EU anyway, as well. But anyhow, stick around. We'll be right back. I want to finish my rant here. Our 1 hour free podcast recaps our show, and it's available wherever fine podcasts are found. And we have the full 3 hour podcast available over at thomhartmann.com if you want to really support our program. We have a special video up over at thomhartmann.com for supporters of our program, and it's about how a letter that the IRS sent out to 3.9 million Americans saved 700 lives. And you're like, wait a minute, the IRS saved 700 lives? How did that happen? Well, it had to do with Obamacare, and it's a fascinating story. And it turns out that this analysis of this IRS mailing was actually the first time that the federal government has done a study that actually proved that people having access to health care produces fewer deaths. For every 1,648 people who got the letter, there was one fewer premature death. I'll explain the whole thing in the video. It's as I said, it's available over at thomhartmann.com for people who are regular supporters of our program, and it is really worth checking out. And it's a great ad, essentially, for a national health care system. California, who had not been anywhere, he hadn't traveled anywhere. He goes to the hospital and he says, I'm really sick and I think these are all the symptoms of coronavirus. Would you test me? And this is in the New York Times today, an article by Roni Karen Rabin and Sherry Fink. A California coronavirus patient had to wait days to be tested because of restrictive federal criteria despite his doctor's request. He tested positive. And, what was it that the restrictive, what was the restriction? The restriction was the CDC will not send will not send a test unless you've recently come back from China. So we may have, this guy caught it somehow in his community. Nobody knows how. And they should be testing probably everybody in that town right now. And they may find hundreds of cases. And they could be putting those people into quarantine. But none of that is happening right now. Donald Trump, his budget for this, that he requested this month, for this fiscal year that begins in October, would cut the CDC's budget by almost 16%. This is from the New York Times. The Department of Health and Human Services budget cut by 10%. Cuts $3 billion to global health programs, a 53% cut to the World Health Organization, a 75% cut to the Pan American Health Organization, and redirects funding to his wall. And what about those kids in the cages down there? Is that not a breeding ground for coronavirus? We've already had, because Trump didn't want to pay for flu shots for them, we've already had several of these children die from influenza. Have we forgotten about the kids in cages? They're still there. They're still in the friggin' cages. And meanwhile, Trump, tweets out, low ratings, fake news, MSDNC and CNN are doing everything possible to make the coronavirus look as bad as possible. Right. So Rush Limbaugh comes out yesterday, the guy who Trump gave the Presidential Medal of Freedom to, and says that we shouldn't be listening to the CDC. This is exactly what he said, the verbatim quote from his transcript from his show. So you got here the CDC urging Americans to prepare for a coronavirus outbreak. This might be bad. This could be bad. Keep your kids at home. Don't go anywhere. It might be bad. We got 53 cases. It might be bad. It might be the stock market's plunging. Okay. This person running this agency, he's talking about the CDC, who does she donate to? Well, her brother is Rod Rosenstein. And then he goes on to say, Dr. Nancy Messonnier of the Centers for Disease Control, which today warned it could be bad. It might be bad. Don't go to school. Don't go to work. Stay home and teleconference. She is the sister of the former Deputy Attorney General Rod Rosenstein. And, of course, Rosenstein is the guy who appointed Bob Mueller. So Rush Limbaugh, this could be life and death. And then you got Joe Hoff, a pro-Trump propagandist, writing a piece trashing this. She's been a doctor with the CDC for 25 years. So what if her brother's Rod Rosenstein? But over at Gateway Pundit, he wrote a piece trashing her. This is another one of these right-wing conspiracy websites. And Trump was asked about this last night at his press conference, and he said, yeah, I think that they're hyping this up to get me, basically. Those weren't his exact words, but, the essence of it. So he puts Mike Pence in charge. Mike Pence was, he was a failed right-wing talk show host. Then he became the governor of Indiana. Then he went to Congress, and now he's Trump's vice president. And there was an HIV outbreak happening in rural Indiana. Mike Pence shut down the Planned Parenthood clinic, which was the only place that tested for HIV in the county. They went from 20 cases to 200 cases before the outbreak was finally under control. Because Mike Pence, because of Mike Pence. The guy who says tobacco doesn't cause cancer.
To the Thom Hartmann Program. Call 202-808-9925.
Honest to God, in 2000, Mike Pence said tobacco doesn't cause cancer. This is our public health genius who's in charge of our coronavirus response? Really? Well, happy Thursday. We really need your help right now. Free Speech TV needs your help. Our country right now is on the brink of what I think is going to be a very serious crisis, both an economic and a public health crisis. Frankly, both of them brought about by years and years and years of Republican policies. In countries with national health care systems, people are not afraid to go to the local doctor's office or the local hospital and get tested for the coronavirus. Because A, they're not going to lose money from work because if you're sick, you get sick time. in every other developed country in the world. And B, they're not going to have to pay for the damn test because in every other developed country in the world, you get medical tests and things like that with no copay and no premium. You don't have to pay a copay for your doctor's office. You don't have to pay for the test. In the United States, this test could cost, if you show up at a hospital emergency room, could cost as much as $5,000. People aren't going to do it. People aren't going to take time off from work, and that's going to make the situation worse. And this all goes back to politics. This all goes back to 40 plus years of Reaganomics and I mean, all the way back to Medicare, for example. When Lyndon Johnson passed Medicare, he wanted it to cover 100% of the costs of elderly people over 65. And what back then was called elderly. And the Republicans said, oh, no, you can't do that. People have to have skin in the game. Otherwise, they'll use too much of the resource. This was their excuse. And so they said, okay, we'll have it pay 80%. You can have private health insurance cover 20%. Over LBJ and the Democrats' objections, the Republicans forced that through. That was the price that they demanded to have Medicare. And, you know, it's the same thing with the health insurance companies. They're saying, oh, well, you got to have some skin in the game. You got to pay the first, $20 for when you go to see your doctor, or $50 or whatever it may be, and the first $5,000 of all medical expenses. You know, the average American has to pay $4,000 a year if they have an Obamacare policy out of pocket. That's crazy. Most Americans don't have $4,000. So this is just going to make things worse, and it's all, as I said, it's all about politics. And where are you hearing that? In an honest and straightforward fashion here on Free Speech TV, which is why Free Speech TV needs your help right now. If we're going to fix these problems that have been created by a century of neoliberal, libertarian, Republican, conservative economic and political policies, if we're going to fix these, we need to have honest conversations about them. And those conversations happen here. They happen here on this program. They happen here on this television network. So please call now, 877-378-8669, and support the Thom Hartmann Program and support Free Speech TV. It matters. It really matters. Your $5 a month donation really matters. Your $10 or $15 a month donation really matters. So please call now, 877-378-8669. With a $20 gift, you get the Proud Student of Thom Hartmann University bumper sticker, or a car magnet to get the vote out. The car magnet says, I'm voting, are you? Right, there you go. With a $50 gift, you get the Just Effing Vote canvas tote bag. We need to be telling everybody, hey, vote. It's important. With $75 gift, you get a great coffee mug to wake you up in the morning. It's the Thom Hartmann Tag You're It coffee mug. And I'm going to have to call up Free Speech TV and make a contribution and get one of those things. With a $240 gift, or $20 a month for a year, you can participate in our virtual meet and greet. We do these a couple times a year where we get 4, 5, 6, 8 people together, all on Skype or Zoom or whatever it is they happen to be using. And, you can see me and hear me, and I can hear you. And if you want to turn your camera on, I can see you. And we'll just have an off-the-record conversation about whatever's on your mind. And some of these are absolutely fascinating. In fact, most of them are. With a $300 gift, we've got the Get Out the Vote pack. And that is a set of Free Speech TV host postcards to send out to your friends and family. Tell them about your favorite shows on Free Speech TV. The car magnet to get out the vote. I'm voting, are you? To get the Just Effing Vote tote bag. And, excuse me, my new book, The Hidden History of the War on Voting. That's with a $300 gift. With a $360 gift, or $30 a month for a year, you get all 3 of the Hidden History books that are out now. The Hidden History of Guns and the Second Amendment, The Hidden History of the Supreme Court, and the most recent one, The Hidden History of the War on Voting, all autographed by the author. With a $1,000 gift, you can come to Portland and hang out in our studio. And, we'll sit here in our peanut gallery. We'll go to lunch down the street, and we'll have a nice time. So that's with a $1,000 gift. So those are the premiums that Free Speech TV is offering and that our show is offering. But the bottom line is that, information is currency. Information is wealth. Information, knowing things is arguably a form of wealth. It is a form of, it empowers people. It empowers you. Actually knowing what's going on, as opposed to just hearing the blather that's coming out of corporate media, who's up, who's down, what's the game, what's the sports. Let's talk about the real issues. We do that here. And it's important stuff. So call now, 877-378-8669. Thank you so much. Please call now. Coming up in the Science Revolution this week, I explain why biodiversity matters and what happens when we lose biodiversity. Margaret Butler from the Extinction Rebellion is here about the activists fighting against oil trains and what happened to them. Dr. David Reichmuth also joins me on the impact of electric cars and find out why people are adding mushrooms to their coffee. That's the Science Revolution, wherever fine podcasts are available. By the way, Friday night of this week, tomorrow night at 7:30, I'll be at Powell's downtown on Burnside, giving a half-hour, 45-minute talk about the hidden history of the Republican war on voting. And I'll be doing the same thing in Chicago on Sunday in Darien at noon at Frugal Muse Bookstore. And please don't try to shake my hand. Let's do terrorist fist bumps, okay? Let's just all agree on that right now. Not just, I'm not, frankly, at this point yet hysterical about coronavirus, but it is flu season. So, let's just be reasonable here. I wanted to tell you one other story, and then I'm going to pick up your phone calls here. Joshua Holland was writing about this over on Alternet. He notes that back in 2000, the USA ran a multi-agency drill. It was called Top-Off, T-O-P-O-F-F, to see what would happen if somebody had tried to poison a major city with a bacterial agent. In this case, it was the plague, Yersinia pestis, this is bacteria, but it's treatable with antibiotics. Viruses are not treatable by anything except antiviral drugs, and we don't know if there's any of those that'll work against coronavirus yet. Although there's a couple of hopeful things, but it's going to take a while. But in any case, this was a disease, the plague, what decimated Europe in the 1400s. But of course, they didn't have antibiotics back then that can be treated with a simple course of Cipro. A quote from Joshua Holland. On the very first day of the exercise, hospital capacity. Now, this was the exercise. The simulation was somebody releases a bunch of plague bacteria in downtown Denver. And then, people get it. They don't know that they're sick. They go home. They take it back to their neighborhoods. And then pretty soon people start getting sick. That's the bottom line. That's what happened. On the very first day of the exercise, hospital capacity became overtaxed and understaffed. Understaffing in crucial areas of the system became apparent as patients streamed into emergency rooms. Low drug stocks, poor communication, and overwhelmed caregivers were all factors in a rapid deterioration of care in the Mile High City. By the third day of the simulation, the study's authors noted, quote, medical care is beginning to shut down in Denver, end of quote. Sometime into the first week of the outbreak, as people reacted to travel restrictions and forced isolation, civil unrest broke out. By the end of the drill, and this is from the federal government's report, quote, by the end of the drill, quote, stores were closed, food supplies ran out because no trucks are being let into the state, rioting began to occur. When the exercise was terminated, between 950 and 2,000 people were dead, and the disease remained uncontrolled. Now, that was 20 years ago. Have we fixed anything since then? No, because Republicans in Congress have blocked every single effort. And now the few small things that Obama was able to get done by executive order, creating an agency inside the National Security Council that would deal with pandemic diseases, creating an agency inside the Department of Homeland Security that would deal with pandemic diseases. Both of those have been shut down by Donald Trump, totally defunded, and the guys running them, they were men in both cases, and the guys running them were fired. This is where we're at right now. And because Republicans, ever since Medicare, have been saying people have to have skin in the game. You've got to have co-pays. You've got to have high deductibles. Otherwise, people will abuse the healthcare system. most people who might even think that they have the coronavirus are not going to be willing to go to the hospital and be hit with a $3,000 bill, or go to the doctor's office and have to pay a $50 copay, and then get hit with a $200 or $300 bill for the test. And that's assuming we've got the damn tests. It's amazing. Natalie in Puyallup, Washington. Hey, Natalie, what's on your mind today?
Oh, hi. I was just wondering, so about socialism and Bernie Sanders, why are the Democrats suddenly turning and on the news and the media turning against Bernie Sanders and making socialism sound like communism, which is really fascinating. Americans keep on making that error, even with Democrats around me and liberals who get very nervous, and I have to re-explain the difference.
Are you worried about socialism and Bernie Sanders?
No, because I'm from Europe originally, and I have to explain to people that socialism exists in democratic countries. That's the same as Democrats, social democrats. That's basically, that we have capitalistic countries, democratic countries, but we do have social programs for the population. So I'm not sure. It seems like there's a lack of information to this day with people who seem around me to be educated or to know. But what concerns me is that the media is really, and especially it's not Fox now that I'm talking about, but maybe CNN, MSNBC, all those media that are actually almost collaborating, like perpetuating this erroneous understanding of socialism.
You're French, right?
When in regards to Bernie Sanders, and that worries me because division and lack of information is what will probably have Trump reelected. So I don't understand what
right.
the.
Well, some of it is opportunists. You've got some people who are simply, they want to. There's other candidates who want to be president, so they're going to say these things to try to take down Bernie. That's fairly predictable. But then you've also got a whole lot of politicians and some ex-politicians like Claire McCaskill on MSNBC who have for years been taking money from the pharmaceutical industry or the healthcare industry or the health insurance industry or the hospital industry, and they're going to continue to dance to the tune of these for-profit industries rather than talk about what's really best for the country. Natalie, last question here for you. As a former citizen and resident of France, and now apparently you've been in the U.S. for a while, your English is nearly crystal clear, nearly perfect. I'm wondering if you think that Bernie Sanders, in advocating Medicare-for-all, no deductibles, no co-payments, everything is covered, Medicare-for-all here in the United States, and advocating free college in the United States, would he be considered a radical in France?
No, because, but see, again, I think the problem is the lack of proper information. Free is not free. It's much, much cheaper.
Right. And
also in France, for example, because the healthcare system is going bankrupt, we had to actually apply for private and additional insurance to cover the co-pays or what people had to pay. So there's a lot of lack of information of exactly, and this is kind of frustrating. Right. I remember years ago, I saw on PBS a segment, report on comparing, and that was, I can't find it anymore, but it was great. It compared Switzerland, South Korea, Japan, and England. And it showed a little bit of how each country has incorporated private, public. I didn't know that Switzerland didn't have a public option and had only a private option until recently.
Yeah, but they're all nonprofit, yes.
It's just really looking at it from an instructive, informative, instead of this kind of, publicity stance. So I know you're a reporter, a journalist, or an anchor, but at the same time, I really wish that the journalistic field would really, really take on the information part to the people.
Yeah, I'm completely with you, Natalie. And it's a crying shame. It's really sad how these attacks, against Bernie and against Warren are not being rebutted by actual facts. Thank you very much for the call, and thanks for listening to the program. Damon in Las Vegas, Nevada. Hey, Damon, what's up?
How you doing? So I've been obsessed with this coronavirus. Finally, you're the first program. Anyway, get to the point where I called. Harvard did a study on this, and they said approximately 70% of the world will be infected. And then I was read up on some other sites, and basically based on what this other site I read, about 150 million people will die from the disease. But that's not the best part about it. More people actually die from panic. And you kind of mentioned it earlier with the Denver study, how 90,000 people died.
Yeah, 2,000 people had died by the third day because, largely because of panic and because of the rioting that came out of it. And it's why I said, just some simple stuff. This is not prepper weird stuff, Have a couple of weeks worth of food in your house. You'll eat it eventually, right? Just the things that you would normally eat that will preserve well. Ask your doctor if you're taking a prescription that you have to take, blood pressure medication, asthma medication, something like that, diabetes medication. Ask your doctor to write a prescription noting that you're going to be traveling on vacation over the next 3 months. Ask your doctor to write a prescription for a 90-day supply. Sometimes you have to pay for it out of pocket, but it's probably a good deal. But you're right. So, Harvard says that probably 70% of the world's population is going to be infected with this. And as I said earlier, this is going to be a major crisis. And this is not just an economic crisis and a healthcare crisis, but it's being made worse by Donald Trump telling lies like he did last night because he thinks it's going to help him politically. And it's going to be made worse by the fact that we've got a healthcare system that has this for-profit component where, it costs money to get tests done. And then on top of that, you got the same problem that we have every year with cold and flu, which I talk about on this show, which is that because we are the only developed country in the world that does not have mandatory sick pay, you're going to have people coming down with symptoms. They think it's the common cold. It might be the coronavirus. And they're going to be the one who's bringing your plate of food to you in the restaurant because they can't take time off because they don't have paid sick pay.
You're listening to Thom Hartmann. Visit ThomHartmann.com for audio and video archives.
Of all the countries in the world prepared for this coronavirus outbreak, the U.S. is the least prepared because of 40 years of Reaganomics. And welcome back. Jeremiah in Jersey City, New Jersey. Hey, Jeremiah, what's on your mind today? Thanks for watching us on Facebook Live.
How's it going there, Thom Hartmann? I'm actually in front of a class that's patiently waiting for me to finish my comments so I could get back to the class.
Okay, hi to your class.
He says, hi, everybody. Say hi.
Oh, how cool is that?
Isn't that cool?
Yeah.
Well, this is my quick point, Tom. And this is as someone who was a medical tourist in Belarus the past 2 summers. One thing I do not understand in the healthcare discussion is for anybody, whether they be Democrat, Republican, or what have you, says, oh, well, we can't afford that. We can't afford Medicare-for-all. Well, my response is, so you're okay with being at the bottom of the developed world?
Right.
You're just going to say, oh, we can't. Like if my kid needs a $25 stipend to afford school supplies, I'm just going to say, no, sorry, I don't have the $25. My kid will be at the bottom.
Yep.
So if you don't have the resources, which we do, well, you better find them.
We are the richest country in the world. We are the richest country in the world. We've got 3 men who own as much wealth as the bottom half of America.
All the arrogance to show for it, Tom.
Yes, yeah, absolutely.
All the rah to show for it. So we say, oh, we're the greatest country in the world. Well, not in terms of healthcare, we're not.
That's right.
Not in terms of education. So first of all, we're not the greatest country in the world. Second of all, even if we were, you shouldn't brag about it and be rude.
Yeah. Well, I think that, we were the first country in the modern era, since the Greeks and Romans, that was founded on the idea that people can govern themselves. And that's still a pretty damn noble thing, although a lot of other countries have adopted those policies and they haven't been contaminated by these right-wing theories, the Milton Friedmanisms, the libertarian stuff. And so, they're better prepared. I mean, in South Korea, when they discovered that there was this one woman in this church who had the coronavirus, they went in and they tested everybody who had gone to that church, and they found, about 100 people who had the virus because she had been there at a potluck and passing food around to people and all these kind of things. We don't even have the test kits for that. And for every single test that happens now in the United States, people have to pay hundreds or thousands of dollars. And it's like, that's not going to happen. And so frankly, I am concerned that we're going to see this thing spread faster in the United States than we're seeing it spread in other countries, because we are so unprepared for this, as a consequence of all these years of these economic policies, which is really tragic. And we really need to build a robust public health care system. I keep saying this is national security as much as it is moral appropriateness. So, Jeremiah, say hi to your class for me, and I hope I didn't say anything I shouldn't have in front of all your little kids.
No, not at all. I think the truth is okay, Tom.
Okay, good talking to you, Jeremiah. Thanks a lot.
Talk to you later.
Thanks for watching us on Facebook Live. Well, what a hoot! We're talking to a classroom full of kids. And this is, and I hope Jeremiah, I'm guessing he probably is teaching civics to his kids. We used to be required during the Eisenhower administration. They made civics required. And during the Reagan administration, they said, you don't have to do civics anymore. And now you've got people who don't know about 3 branches of government and don't know about balance of power and don't even understand the founding principles of the Enlightenment. They have no idea who John Locke was, for example. Frankly, many of them have no idea who Jefferson was, who took Locke's ideas and put them into the Declaration of Independence. And then, Madison and Hamilton put them into the Constitution. So anyhow, good on you, Jeremiah, and hi to your classroom. We'll be right back. Hey, did you know that Hillary Clinton actually won Pennsylvania, Wisconsin, North Carolina, and Florida in the 2016 election? It's on page 92 of my new book, The Hidden History of the War on Voting. And tomorrow night at 7:30 in Powell's downtown in Portland, I will be giving a talk about that, the hidden history of the war on voting, and signing books. And then Sunday at noon at Frugal Muse Books in Darien, suburban Chicago, Illinois, I will be there. And please, let's terrorist fist bumps instead of shaking hands. Marilyn in Madison, Wisconsin. Hey, Marilyn, what's on your mind today?
Hi, a couple of things. I'll just give you bullet points. One, watch the economy when the schools are shut down indefinitely. I remember snow days with my 2 boys being a single mom, and it was hell. Number 2, a cautionary tale about health insurance. My son was in the Marines for 7 years. He separated, worked for the sheriff's department, he's a sheriff's deputy. The county had cut back on the health insurance plans. They had a bad year and ended up $10,000 in debt in their copays and their deductibles. And
wow.
He's now in Afghanistan because he wanted his family to have decent health care so he could have the Humana TRICARE.
So he became, so he's in Afghanistan. I mean, this was, Thomas Jefferson said, I hope I shall never live to see the day when the young men of my country are willing to be shot at for a sixpence. That's where we're at.
There you go. That's where we're at. The other thing about the coronavirus is it's looking more and more like, and I worked in infectious disease for 10 years, it's looking more and more like that the majority of these illnesses are asymptomatic or of the cold variety. People
think they have a cold, right?
So what we're seeing is the tip of the iceberg.
Yes.
This is disseminated already.
Yes, I agree.
One last thought, and then I'll let you go. That young man or young woman who was diagnosed in Davis yesterday, or
California.
It became known yesterday, he or she is lucky that he ended up at UC Davis Medical Center. Because if he were in a rural hospital, it may not have been captured that he might have coronavirus, and they may not have had the ability or the know-how to contact the CDC and keep lobbying for a test kit.
Right. Now, Marilyn, it says here that you're a nurse in Madison, Wisconsin. I have one of my best friends. In fact, he's been a guest on this show. He's a dentist in Washington, D.C. And he came on and did Ask the Dentist segment back when Obama was president, and things were boring, and we could have shows about things like that. But anyhow, I got an email from him a couple of days ago saying that, as a dentist, he has to put a new mask on for every single new patient. So he goes through, 20, 30 masks a day. And he said that he can't get masks anymore, that the company in D.C. that was supplying the surgical masks to the dental practices was buying them from China, and they're no longer shipping them out of China. Are you hearing things like that?
Target's out of them. I was in Target yesterday. They're out of them. They were also out of hand sanitizers. I called my pharmacist on Monday because it was percolating all weekend that I shouldn't just have 30-day refills on my two prescription medications. He said, I don't know if I can get it. My distributor is having trouble getting these medications because they are Chinese. The other two places that supply most of our generic meds are India, which is dealing with COVID-19.
Right. Plus India and Turkey get their raw materials from China. Forgive my interrupting, but that's the case.
Right. So it's a cluster, you know what, and just from my little background as a nurse in infectious disease, this administration has done absolutely everything wrong on the checklist of response to a suspected pandemic.
Yes.
Everything.
Yes. And they shut down the systems that Obama put in place after the outbreak of what was it in Ebola?
It was Ebola. Yeah. They've done absolutely everything wrong. And by the way, the Dow is down 800 again today. Yeah. So look how well this is working out for everybody. One last thing, and then I'll let you go. Pretend that you have OCD. Wash your hands, even if you think you just did it and you don't need to wash your hands. Yes. Wash your hands. Never got sick taking care of infectious disease patients because I washed my hands.
And the other thing is, the average person touches their face 20 times an hour. It's just something that people typically do. Start getting OCD about that too, because that's how you transmit. You touch a doorknob or an airplane seat or something, and then you touch your lips or you wipe a little moisture off your nose, or you touch the edges of your eyes, and boom, it's now inside your body.
Definitely, that's the only thing these masks are really good for preventing spreading the disease to somebody else if you've got an infection. And to keep your hands off your nose and your mouth.
Right. Yeah. If you have any symptoms, you should be wearing a mask. But wearing a mask is not going to prevent you from getting this disease. It's mostly through your hands, and that's why we all need to become OCD about that. Marilyn, thank you very much. It's great to hear from you. I appreciate the call. Charles in Miami. Hey, Charles, what's up?
Hey, how you doing, Tom? I love the show.
Thank you.
I've been watching the BBC, and I knew that this was a pandemic. It bothers me that a couple of weeks ago that the WHO came out and said this is not a pandemic. To be honest with you, I just think they were being pressured by.
They have reversed themselves. At that point, it was not on every continent. Now it is.
Okay, and now my biggest concern is this, since that has even started. What Bernie is saying that we have millions of Americans that's uninsured. I don't think this government. I don't think this particular administration has what it takes, the capabilities. We already know what Bush did with Katrina, and we already know the Republican outlook as far as any type of pandemic.
Well, we know what Trump did with Maria. 3,000 people died in Puerto Rico, while Donald Trump was lying and saying it was only 15 people. I mean, we've already seen this. So
this is something that the Democrats have to hop on. That Republicans, this is where they fail, because they treat everything like a business, even in an instance like this. And my thing is, Pete Buttigieg and Amy Klobuchar, when they start doing that business as usual stuff, we as liberals need to stand up. Progressives need to say, listen, this country has changed, because you can look at the groundswell and you can look at the momentum that Bernie has.
Yeah, business as usual isn't going to make it. And Charles, forgive my interrupting, but I got 5 seconds here. You mentioned that there's 40 million people in the United States who have no health insurance whatsoever. What that means is there's 40 million people in the United States who, if they get the symptoms of coronavirus, are not going to go to the doctor, are not going to go to the hospital, and instead of just spreading it to the average 2.2 people, they're going to spread it to 20 or 30 people. And you're going to see a serious problem in this country because of our healthcare system being brought to you by for-profit health insurance company banksters and hospitals that are turned into for-profit hustles.
You're listening to Thom Hartmann.
have a special video up over at thomhartmann.com for supporters of our program, and it's about how a letter that the IRS sent out to 3.9 million Americans saved 700 lives. How did that happen? Well, it had to do with Obamacare, and it's a fascinating story. And it turns out that this analysis of this IRS mailing was actually the first time that the federal government has done a study that actually proved that people having access to health care produces fewer deaths. For every 1,648 people who got the letter, there was one fewer premature death. I'll explain the whole thing in the video. It's you know, as I said, it's available over at thomhartmann.com for people who are regular supporters of our program, and it is really worth checking out. And it's a great ad, essentially, for a national health care system. Well, happy Thursday. We really need your help right now. Free Speech TV needs your help. I mean, our country right now is on the brink of what I think is going to be a very serious crisis, both an economic and a public health crisis. Frankly, both of them brought about by years and years and years of Republican policies. In countries with national health care systems, people are not afraid to go to the local doctor's office or the local hospital and get tested for the coronavirus. Because A, they're not going to lose money from work, because if you're sick, you get sick time in every other developed country in the world. And B, they're not going to have to pay for the damn test, because in every other developed country in the world, you get medical tests and things like that with no copay and no premium. You don't have to pay a copay for your doctor's office. You don't have to pay for the test. In the United States, this test could cost, if you show up at a hospital emergency room, could cost as much as $5,000. People aren't going to do it. People aren't going to take time off from work, and that's going to make the situation worse. And this all goes back to politics. This all goes back to 40 plus years of Reaganomics and I mean, all the way back to Medicare, for example. When Lyndon Johnson passed Medicare, he wanted it to cover 100% of the costs of elderly people over 65. And what back then was called elderly. And the Republicans said, oh, no, you can't do that. People have to have skin in the game. Otherwise, they'll use too much of the resource. This was their excuse. And so they said, OK, we'll have it pay 80%. You can have private health insurance cover 20%. Over LBJ and the Democrats' objections, the Republicans forced that through. That was the price that they demanded to have Medicare. And, you know, it's the same thing with the health insurance companies. They're saying, oh, well, you got to have some skin in the game. You got to pay the first, $20 for when you go to see your doctor, or $50 or whatever it may be, and the first $5,000 of all medical expenses. You know, the average American has to pay $4,000 a year if they have an Obamacare policy out of pocket. That's crazy. Most Americans don't have $4,000. So this is just going to make things worse. And it's all, as I said, it's all about politics. And where are you hearing that? In an honest and straightforward fashion here on Free Speech TV, which is why Free Speech TV needs your help right now. If we're going to fix these problems that have been created by a century of neoliberal, libertarian, Republican, conservative economic and political policies, if we're going to fix these, we need to have honest conversations about them. And those conversations happen here. They happen here on this program. They happen here on this television network. So please call now, 877-378-8669, and support the Thom Hartmann Program and support Free Speech TV. It matters. It really matters. Your $5 a month donation really matters. Your $10 or $15 a month donation really matters. So please call now, 877-378-8669. With a $20 gift, you get the proud student of Thom Hartmann University bumper sticker, or a car magnet to get the vote out. The car magnet says, I'm voting, are you? Right, there you go. With a $50 gift, you get the Just Effing Vote canvas tote bag. We need to be telling everybody, hey, vote. It's important. With $75 gift, you get a great coffee mug to wake you up in the morning. It's the Thom Hartmann Tag You're It coffee mug. And I'm going to have to call up Free Speech TV and make a contribution and get one of those things. With a $240 gift, or $20 a month for a year, you can participate in our virtual meet and greet. We do these a couple times a year where we get 4, 5, 6, 8 people together, all on Skype or Zoom or whatever it is they happen to be using. And you can see me and hear me, and I can hear you, and if you want to turn your camera on, I can see you, and we'll just have an off-the-record conversation about whatever's on your mind, and some of these are absolutely fascinating. In fact, most of them are. With a $300 gift, we've got the Get Out the Vote pack, and that is a set of Free Speech TV host postcards to send out to your friends and family. Tell them about your favorite shows on Free Speech TV. The car magnet to get out the vote. I'm voting Are You, to get the Just Effing Vote tote bag, and excuse me, my new book, The Hidden History of the War on Voting. That's with a $300 gift. With a $360 gift, or $30 a month for a year, you get all three of the Hidden History books that are out now. The Hidden History of Guns and the Second Amendment, The Hidden History of the Supreme Court, and the most recent one, The Hidden History of the War on Voting, all autographed by the author. With a $1,000 gift, you can come to Portland and hang out in our studio, and we'll sit here in our peanut gallery. We'll go to lunch down the street, and we'll have a nice time. So that's with a $1,000 gift. So those are the premiums that Free Speech TV is offering, and that our show is offering. But the bottom line is that information is currency. Information is wealth. Information. Knowing things is arguably a form of wealth. It is a form of, it empowers people. It empowers you. Actually knowing what's going on, as opposed to just hearing the blather that's coming out of corporate media, who's up, who's down, what's the game, what's the sports. Let's talk about the real issues. We do that here. And it's important stuff. So call now, 877-378-8669. Thank you so much. Please call now.
This is the Thom Hartmann Program.
Welcome back. Thom Hartmann here with you. I was ranting in the previous hour about how not only is putting Mike Pence in charge of the coronavirus sort of like putting Hannibal Lecter in charge of our restaurant systems, but that our for-profit health insurance and healthcare delivery systems from for-profit hospitals that are now turning into giant chains and monopolies, which is documented in my next book, The Hidden History of Monopoly and the Death of the American Dream. And these for-profit health insurance companies that are basically banks, and people running them basically banksters. Well, the story of this guy in Florida who thought he had coronavirus because he'd just come back from China and he had a bad cold. He goes to the hospital to get tested. He gets a test. He gets home. He's got a $3,200 bill in the mail, and there's a note on there that this does not yet include all charges. Right? Apparently, the doctor's bill hasn't been added to it yet, and his copay was like $5,000, so he has to pay the $3,200 to get tested. How many people are going to go to the hospital and or even their doctor's office to get tested when they get the symptoms of a cold and are wondering, is this the coronavirus? When they're looking at a $3,000 bill. It's insane. How did we get here? Wendell Potter used to be an executive with one of the big five, I believe it was Aetna, one of the big five insurance companies, health insurance companies, these banksters. He figured out what he was doing was wrong and left the business and has been a whistleblower ever since, has written a brilliant book about it. He is the president now of Business for Medicare-for-all. The website is Medicare-for-all.org, and you can tweet him at Wendell Potter. Wendell, welcome back to the program, and remind me of the title of your book.
Deadly Spin is the name of the book.
Deadly Spin.
And I worked for two big insurance companies over the course of 20 years, Humana and Cigna, so I know how these companies operate. Okay,
so knowing how these companies operate, what kind of response can we expect, those of us who have private health insurance with one of these big health insurance companies, if we get symptoms and we're worried that it might be coronavirus? What do we do? How's this going to play out?
I think very chaotically, and you're exactly right. People are afraid to go to the doctor, go to the ER, because they know they're very vulnerable to having a big bill come in, even if they have health insurance. And I saw this coming. One of the reasons I left my job is because I was expected to be a cheerleader for a trend in the industry that has gotten to where we are right now, and that is to push every last one of us into a high deductible plan. And the consequence of that is that not only do we still have almost 30 million people in this country who don't have health insurance, you have twice that many who are now underinsured. That means their deductibles are so high, they have to pay so much out of their own pocket before their coverage kicks in, that people are not getting the care that they need already. So now, as we have the very real possibility of having a real epidemic in this country, people needing and should be going to the doctor to get tested and to get care, afraid to do it because they're afraid of getting one of these big bills in the mail.
Influenza has a fatality rate of 0.1%. Our head of the Department of Homeland Security yesterday was being interrogated in front of Congress, and he said he thought it was identical to that of the coronavirus, 2%. He was, of course, wrong. He didn't know what he was talking about. But he's the guy in charge of Homeland Security who's supposed to protect us. God help us. Anyhow, what that means is that 1 out of every 1,000 people who gets the flu dies from it. 1 out of every 1,000. And the health insurance system of this country has been dealing with that for years. 35,000 people a year die, which probably means a couple 100,000 people every year end up on respirators or end up hospitalized, and some small percentage of them die. But, they end up in bad shape. The coronavirus is 2.3% from what we know so far. It's probably not quite that bad because there's probably a lot of undiagnosed cases that it's being compared against. But let's say it's 2%. That means out of every 100 people, keep in mind, 1 out of 1,000 dies of the flu. This would be 2 out of every 100 people will die from the coronavirus, which means instead of, out of 1,000 people, there being, 2 or 3 people who need hospital care and respirators and things like that, it's going to be more like 7 or 8 out of every 100 or 70 or 80 out of every 1,000. How does our system deal with this?
I think our system is very ill-equipped to deal with this, for a lot of reasons. Not only do we have a health insurance system that is just a profit-making operation and not caring how many people have coverage and how many people are underinsured, you've got that. But you've also got on the delivery side profit motivation that has led to many rural hospitals closing in recent years, as well as safety net hospitals. Like here in Philadelphia, where I live, one of the largest safety net hospitals that have been around for decades, generations, has closed because it was owned by a hedge fund team or a company, and so it was profit taking. And here we are.
What's a safety net hospital, Wendell?
It was here in Philadelphia.
What is a safety? Is that a hospital that kind of fills in the cracks of the rest of the healthcare system around it?
It is. It is a hospital that is available to meet the needs of the community, regardless of insurance status, and treats largely everybody in the community. But they are especially available to people who are on Medicaid and who just don't have insurance. And we're seeing them disappear across the country as we have seen rural hospitals disappear. So people who live in small communities are now finding that they have to drive a long way to get the care that they need, and are less likely to seek the care that they need. The other thing is that as we have been obsessed with making money in healthcare, we've not been investing in public health. It's estimated that 3 cents of every dollar that we spend on healthcare, only 3 cents goes to public health and our public health infrastructure. And I've talked to some public health officials who think that's even an overstatement. So we have such a dysfunctional and fractured healthcare system that if this becomes a real epidemic, we will see the consequences of just failing to really have a healthcare system and a healthcare infrastructure that we really need.
Remarkable. So what should we be doing, Wendell Potter? I mean, you've been a senior executive in 2 major health insurance companies. You know how health insurance works in this country, and by extension, you know how our healthcare system works. I know that you've done your research on other countries and how healthcare is done in Europe and in Mexico and Canada and all over. What is the optimal system to make America resilient health-wise to things like a coronavirus epidemic? What do we need to do, and is it too late to do any of them quickly?
Well, it's too late to do some of, the ultimate solution is to move to a system in which we improve and expand the Medicare program to cover everybody. It's a program that's been around now for more than half a century and meets the needs of the oldest in our society. And does it much more efficiently than private insurance companies do. And it's also secure. You can't lose it like you can a private insurance plan. So that's the ultimate solution. We need to look also to other countries to see what works well there. But again, we've got this program in place that just needs to be improved and expanded to cover everybody.
This program being Medicare.
Transition. That program being Medicare, and it would be a much easier transition to get everyone into that than it would be to get everyone enrolled, or a lot of people enrolled in the Obamacare plans because of the enormous complexity of dealing with multiple insurance companies. So it would be a much easier transition.
So the real simple thing is to do, in my mind, is to do two steps, and I'd like you to reality check this for me. Step number one, we pass federal legislation that says there's no longer a 20% copay with Medicare. Medicare covers 100% of your expenses, no deductibles, no copays, number one. And number two, the eligibility age for Medicare is dropped from 65 to birth.
Yeah, that's exactly right. And you may do it over 2 or 3 years to get from 65 to birth, but that's exactly what we need to do. Maybe we're working at both ends of the age spectrum, but we can do that. We can get there in a relatively short period of time. And you're right, getting rid of the deductibles in the basic Medicare program is absolutely essential, and it is something that both the bills in the House and Senate, sponsored by Bernie Sanders, and the House by Pramila Jayapal, that would do exactly that. It would improve the basic Medicare program to eliminate those deductibles. And again, as we were talking, it is that out-of-pocket requirement that is keeping so many people from getting the care that they need when they need it.
Right. Remarkable. So, where, I guess this is just a matter of of political will, right? I mean, that's the bottom line.
It's a matter of political will. Yeah, and our politicians, to a large extent, are just our followers, not leaders. We have a few that are really leading the charge for this. Two, on the debate stage running for president, champion Medicare-for-all. We all need to support them. But I think other politicians are beginning to catch on. We look at the voters in the first 3 states. 60% of those who voted said they support Medicare for all, knowing that it would mean the elimination of private insurance companies. They want to get rid of those guys.
Right. And I guess the big question is what happens to all the people who used to work in the health insurance companies? They can work for Medicare, right?
A lot of them can work for Medicare. A lot of them can go back to delivering patient care.
There you go. Wendell, we're out of time, but thank you so much for being with us. Hang on just a second.
This is the Thom Hartmann Program.
Wendell Potter, former health insurance executive, president of business for Medicare-for-all.org. Check it out. You can tweet him at Wendell Potter. And welcome back. Wow. Paul in Lucerne, California. Hey, Paul, what's on your mind today? Paul in Lucerne, watching Free Speech TV? I got no Paul. Janet in Bainbridge Island, Washington, listening to KBCS. Hey, Janet, what's up?
Oh, good morning, Tom. I've been listening to all of the terrible things that what can happen because of this. But one of the good things we could try to have happen is, beginning with your audience, you could start talking about how to cooperate, how to make sure that your neighbors are being okay, and that all of you have an understanding of how you're going to coordinate if there are, if somebody needs to have their kids watched and you can be one to do that, well, that would be a way to let somebody go to work. And also, it's really a good political time to start talking about how to make the country better.
Yes.
So that we're getting a perfect opportunity to see how bad it can all go, but maybe start talking about it from a different perspective.
Yeah, I get it. And thank you for the call, Janet. And you go back and you look at the history of the Black Plague, the bubonic plague in Europe in the 14th century. And it led to the Renaissance. people went through some really tough. I mean, a third of Europe died. This isn't going to be nowhere near that bad, but people pulled together, communities happened, and out of the Renaissance came a lot of the ideas that animated the Enlightenment, that animated the United States and democracy and egalitarian governments and things. And so this might be an opportunity for us to, pull together, as it were. Eddie in Agra, Kansas. Hey, Eddie, thanks for watching us on YouTube. What's up?
Well, thank you for your program, Tom. I agree with about everything you said, but I want to state first off, there is only one person and one group that is really concerned for the poor and have a heart for the poor, and that is Bernie Sanders and the progressives. And another thing I want to hit here is that all the Republicans, the hypocrite Republicans, are so worried about socialism, but do you realize that every farmer is benefiting from a socialistic program? Every billionaire, everyone in between is getting some sort of socialistic help. Our old folks are on Social Security, that's socialistic, but everybody, the Republicans are trying to defeat Medicare-for-all by setting up a fear of socialism. Well, everybody has it. It's just having... it affects many of the upper class, is what I'm saying. Mm-hmm. And what they're afraid of is having it for everyone.
Yeah, I agree. And I think that this coronavirus, one of the other good things that might come out of this is it's causing people. I've been, debating conservatives on this for 15 years now on this show. And the thing I constantly say, they say, well, we got to have free market solutions and you can't just have everybody have free health insurance, blah, 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 blah. And I say, do you really want that person sitting next to you on the bus or on the airplane who's coughing because they have tuberculosis but can't get it treated because they don't have health insurance and are too poor to afford it? Do you really want them coughing all over you? Shouldn't we, isn't this a matter of national security or health security? Shouldn't we have everybody in the country covered just to keep all the rest of us safe, even those of us who have very good health insurance plans? And, Eddie, you nailed it. And that's my take on it. Anyhow, we'll be back. It's 20 minutes past the hour here on the Thom Hartmann Program, Talk Media for the rest of us. Stick around. We'll be right back. Our 1 hour free podcast recaps our show, and it's available wherever fine podcasts are found. And we have the full 3 hour podcast available over at thomhartmann.com if you want to really support our program. Welcome back. Thom Hartmann here with you. Well, it started, a week ago. In fact, it might have even been more than a week ago. I first started suggesting, let's not panic. Let's just, keep our heads about ourselves and look at this rationally. But I have, Louise and I were living in Detroit when the Arab oil embargo happened, and the supermarket shelves emptied in 2 days. We were living in Atlanta, Georgia, when there was a giant hurricane coming. I forget which one it was. It was back in the 80s. And the stores, they didn't completely empty, but, water, paper towels, tape, plastic, all, the things you need to prepare for, gone. Huge price gouging, things like that. Louise was looking on Amazon last night, and she found that surgical masks that used to be 5 cents, 10 cents each are now, $1 to $10 each. I mean, it's like, these are happening. And here we have this report. This is from the, I don't know which network it's affiliated with, but it's a television station in Honolulu, KOHN, Channel 2. And this is a report by Kimberly Speakman that was published it was published last night, 9 o'clock, 10 o'clock Hawaii time last night. Supplies are flying off the shelves Wednesday, with some shoppers taking pictures of empty shelves at stores across Oahu, the island on which Honolulu is located. This comes after a message from the health department to stock up on necessities. There are no coronavirus cases here in Hawaii, but health officials want people to have food supplies and medicine just in case. At Costco Iweli, this is, a little town outside of Honolulu, and I'm sure I'm mispronouncing it, my apologies, flatbeds were overflowing with boxes of canned goods, bottled water, toilet paper, and paper towels. One shopper picked up all these things and more. One said Honolulu resident Keen Zakimi, the essentials: toilet paper, paper towels, bottles of water, soap, a lot of Clorox stuff, cleaning supplies. I figure with all the coronavirus scare and everything, it's better to be safe than sorry. Others picked up on foods that could last a long time. Kilua resident Marlene Nation said it's always a good idea to stock up with things that are protein items like albacore tuna, or things that have a shelf life that's long time, protein items like black beans. This is just an extra precaution, no panic. And then they say, you know, panic buying has not broken out in Honolulu, but the stores are emptying out fast. So, you know, like I said, you know, be thoughtful, be cautious, but be prepared. Get ready. Because, you know, Trump is completely incompetent, and we have a healthcare system, as Wendell Potter just pointed out, that is not going to make it easy for people to get tested if they think they might have coronavirus, and so you're going to have more people spreading this around the United States. I suspect that this outbreak is going to be worse here than what we've seen anywhere else in the world because of the incompetence of this administration and because of 40 years of Reaganomics trying to consistently tear apart our social safety net when it comes to health. And, you know, not a good thing. Michael in Princeton, Minnesota. Hey, Michael, what's up?
Hey, hello, Tom. I went into the pharmacy this morning, and I was going to pick up a prescription. Normally, I pick up a 90-day supply. Medica turned around and changed their policy and would only pay for 30. So they had to take back 60 of them and only give me 30.
Yeah.
So
that happened to Louise with her Synthroid. She went to the pharmacy day before yesterday, and they said, we won't give you a 90-day supply. Your health insurance company won't pay for it. And so she said, how much is a 90-day supply? And they said $25. And she said, here's $25. And she got it. I don't know what the drug you're taking costs. Mine is, 90-day supply is $180, but I pay, I would pay that if I had to. My insurance company paid for a 90-day supply, but my doctor physically wrote a prescription that said, we'll be traveling, please fill for 90 days. He wrote that with a Sharpie on the prescription pad, and I handed it to the pharmacist, and they did it.
I got to dig my paperwork out of the garbage and find out what it would cost me. I may go back and do that. I hadn't thought of that. Anyway, then there was a financier in the Trump administration, I don't remember his name, and he was talking about that we need to start manufacturing this stuff here in the United States.
Yes.
And also...
Well, Peter Navarro, Trump's trade guy, has been saying that for years.
Yeah. And also, I was talking to the lady behind the counter while I was waiting for my prescription to be altered, and she said all the masks... We're a little town of 5,000 people in Minnesota, which really isn't affected yet. And she said all the masks are sold out. Yeah. And I said, well, that's why I'm going to go down to the hardware store. And she said, I never thought of that. I told her, I said, well, before you send a bunch of people down there, go buy what you need, and then send your people down there and buy those ones with, for painting masks.
Right.
With the
although those will not be as effective. But, the bottom line for masks is wearing a mask is probably not going to prevent you from getting it unless somebody's sneezing in your presence. More important would be, if you wanted to suit up like a giant condom, would be to wear latex gloves, because most of this stuff people seem to be getting it from contact with contaminated surfaces. But my friend, the dentist in D.C., said he can't even buy masks anymore. Michael, I got to run, but thank you for the call. It's good to hear from you. It's 27 and a half minutes past the hour. We'll be right back.
You're listening to the Thom Hartmann Program. Call 202-808-9925.
With our conversation about this, I also want to there's a lot of other news out there, including economic news, that's consequential. We'll get to that, too, as we continue through the program. Well, happy Thursday. We really need your help right now. Free Speech TV needs your help. I mean, our country right now is on the brink of what I think is going to be a very serious crisis, both an economic and a public health crisis. Frankly, both of them brought about by years and years and years of Republican policies. In countries with national health care systems, people are not afraid to go to the local doctor's office or the local hospital and get tested for the coronavirus. Because A, they're not going to lose money from work, because if you're sick, you get sick time in every other developed country in the world. And B, they're not going to have to pay for the damn test because in every other developed country in the world, you get medical tests and things like that with no copay and no premium. You don't have to pay a copay for your doctor's office. You don't have to pay for the test. In the United States, this test could cost, if you show up at a hospital emergency room, could cost as much as $5,000. People aren't going to do it. People aren't going to take time off from work, and that's going to make the situation worse. And this all goes back to politics. This all goes back to 40 plus years of Reaganomics and I mean, all the way back to Medicare, for example. When Lyndon Johnson passed Medicare, he wanted it to cover 100% of the costs of people over 65. And what back then was called elderly. And the Republicans said, oh, no, you can't do that. People have to have skin in the game. Otherwise, they'll use too much of the resource. This was their excuse. And so they said, OK, we'll have it pay 80%. You can have private health insurance cover 20%. Over LBJ and the Democrats' objections, the Republicans forced that through. That was the price that they demanded to have Medicare. And, you know, it's the same thing with the health insurance companies. They're saying, oh, well, you got to have some skin in the game. You got to pay the first, $20 for when you go to see your doctor, or $50 or whatever it may be, and the first $5,000 of all medical expenses. You know, the average American has to pay $4,000 a year if they have an Obamacare policy out of pocket. That's crazy. Most Americans don't have $4,000. So this is just going to make things worse. And it's all, as I said, it's all about politics. And where are you hearing that? In an honest and straightforward fashion here on Free Speech TV, which is why Free Speech TV needs your help right now. If we're going to fix these problems that have been created by a century of neoliberal, libertarian, Republican, conservative economic and political policies, if we're going to fix these, we need to have honest conversations about them. And those conversations happen here. They happen here on this program. They happen here on this television network. So please call now, 877-378-8669, and support the Thom Hartmann Program and support Free Speech TV. It matters. It really matters. Your $5 a month donation really matters. Your $10 or $15 a month donation really matters. So please call now, 877-378-8669. With a $20 gift, you get the proud student of Thom Hartmann University bumper sticker, or a car magnet to get the vote out. The car magnet says, I'm voting, are you? Right, there you go. With a $50 gift, you get the Just Effing Vote canvas tote bag. We need to be telling everybody, hey, vote. It's important. With $75 gift, you get a great coffee mug to wake you up in the morning. It's the Thom Hartmann Tag You're It coffee mug. And I'm going to have to call up Free Speech TV and make a contribution and get one of those things. With a $240 gift, or $20 a month for a year, you can participate in our virtual meet and greet. We do these a couple times a year where we get 4, 5, 6, 8 people together, all on Skype or Zoom or whatever it is they happen to be using. And, you can see me and hear me, and I can hear you. And if you want to turn your camera on, I can see you. And we'll just have an off-the-record conversation about whatever's on your mind. And some of these are absolutely fascinating. In fact, most of them are. With a $300 gift, we've got the Get Out the Vote pack. And that is a set of Free Speech TV host postcards to send out to your friends and family. Tell them about your favorite shows on Free Speech TV. The car magnet to get out the vote. I'm voting, are you? To get the Just Effing Vote tote bag. And, excuse me, my new book, The Hidden History of the War on Voting. That's with a $300 gift. With a $360 gift, or $30 a month for a year, you get all 3 of the Hidden History books that are out now. The Hidden History of Guns and the Second Amendment, The Hidden History of the Supreme Court, and the most recent one, The Hidden History of the War on Voting, all autographed by the author. With a $1,000 gift, you can come to Portland and hang out in our studio. And, we'll sit here in our peanut gallery. We'll go to lunch down the street, and we'll have a nice time. So that's with a $1,000 gift. So those are the premiums that Free Speech TV is offering and that our show is offering. But the bottom line is that, information is currency. Information is wealth. Information, knowing things is arguably a form of wealth. It is a form of, it empowers people. It empowers you. actually knowing what's going on, as opposed to just hearing the blather that's coming out of corporate media, who's up, who's down, what's the game, what's the sports. Let's talk about the real issues. We do that here. And it's important stuff. So call now, 877-378-8669. Thank you so much. Please call now. Coming up in the Science Revolution this week, I explain why biodiversity matters and what happens when we lose biodiversity. Margaret Butler from the Extinction Rebellion is here about the activists fighting against oil trains and what happened to them. Dr. David Reichmuth also joins me on the impact of electric cars and find out why people are adding mushrooms to their coffee. That's the Science Revolution, wherever fine podcasts are available. Welcome back. Thom Hartmann here with you. I told you the story last week about how we were getting our chat room on YouTube, where we live stream our show. Live stream it. Anyhow, our chat room on YouTube was being bombed by bots using the same artificial intelligence software that the porn bots use. We periodically suffer porn bot attacks there, but these were Bloomberg bots. And how Nigel has kind of figured out how to keep them out and how to solve the problem, although they're literally creating new accounts every few seconds in some cases. We've seen the same thing over on Facebook. But Nate was just telling me a story that he saw on Facebook this morning about a Bernie supporter. And, we all know that Bloomberg is paying people $2,500 a month to be activists for him on social media and to go out door to door and canvass and things, which is a pretty good paycheck, right? So anyhow, this Bernie supporter opens his front door and here's a Bloomberg guy. And he says, I'd like to suggest that you support Mike Bloomberg and you should vote for Mike Bloomberg. And the guy who answers the door says, I'm going to support Bernie Sanders. And the Bloomberg guy says, hey, cool, me too. We should get together at the Sanders meetup after I get off work. Oh, my God. Anyway, Paul in Woodinville, Washington. Hey, Paul, what's on your mind today?
Hey, Tom. Let me start my riff about the economy this way with some information. Washington State has passed a long-term care act, which it's funded by a 0.58% payroll tax, obviously because there's no income tax there.
Right.
But it will offer up to $36,000 in long-term care. The requirements are you have to work only 500 hours a year, which is about 10 hours a week. And if you're, self-employed or something, you can pay into it. That also, Washington State will be rolling out, I think they're going to try to roll out a public option funded by the state in 2022. I actually did some work on the testing the website. Oh, I'm probably not supposed to say that. It's my NDA. But no, I'm not saying what I saw. I'm just telling you. That's news. That everyone knows that.
Okay.
But this
get it straight here, Paul.
Yeah. Well, anyway, this prompted our friend Lars Larson to say, "This is great. The only reason that Washington State can afford to be so progressive is because of our great economy." And I about fell on the floor laughing, and I had to call our friend Lars Larson and say, "Lars, I think you got it backwards. The reason we have such a great economy is because we're so progressive."
Exactly.
These companies, these corporations chose to grow up here. Microsoft, Amazon, Starbucks. When I moved here in 1990, Microsoft had one building. They didn't have a college campus. There was no Amazon, and there was only one Starbucks in the market downtown. And I said, but even funnier is, what is your excuse for these ruby red states that have low taxes, low wages, low budget boogie, low voltage economies? What's their excuse for not being able to afford to be progressive? And he had absolutely no answer except to, obfuscate and tell me that, well, Amazon was going to build 28 skyscrapers in downtown Seattle, and now they're only going to build 14.
Right.
And I said,
yeah, I get it. I got it, Paul. Paul, I'd rather not mention other talk show hosts on this show. So in the future,
okay, well, let me just go ahead with my point here was that our economy, our Republican economy, is once again teetering on the brink of recession.
Yes.
And we have had 2 quarters. Third quarter 2019 was 1.9% growth. But even more funny, I mean, that's bad because the second quarter was 3.1, the only time that Trump ever got over 3%. But the fourth quarter was only 2.1%, which is interesting because that was the holidays. We only got a 0.2% bump
for Christmas.
And now, and you know, the coronavirus was certainly around in China during the holiday. We just got lucky that it wasn't discovered because probably people in China had asymptomatic or just cold and flu-like symptoms, and it could have been detected, but it wasn't.
Right.
But my brother, who works in Detroit in the auto industry as a supplier, he's a design engineer, has said that they haven't got a shipment from their factory in China in over 2 weeks.
Right. Yeah,
and they're talking about sending people home.
Yep, you're going to start seeing, I mean, we're starting to see this now with pharmaceuticals. We're already, you know, I told the story of my friend who's a dentist in D.C. that even dentists can't get face masks now because they're all made in China. Latex gloves made in China. I mean, there's essential medical supplies made in China. 150 according to the the FDA, according to the Food and Drug Administration. There are over 150 essential drugs that are only available from China right now because so much of our supply chain, we used to manufacture these pharmaceuticals down in Puerto Rico because we gave a special tax break to Puerto Rico to manufacture drugs. The Bush administration did away with that tax break because, you know, why should we be supporting a country full of brown people who speak Spanish? And all that manufacturing then went to China. And even the drugs that are made in India, like, you know, the blood pressure medication I take, the bottle says manufactured in India. But if you look it up, the raw material is made in China. And they ship it to India where they press the pills. And then, you know, India ships it here and we're told, and they ship it to Canada and we're told we can't go to Canada to buy the same drug because it's not safe, you know. I mean, it's just nuts.
Well, the point being, Tom, is that this recession has started back in June in the beginning of the
manufacturing has been in recession for 3 quarters now, Paul.
Yeah, exactly.
3 consecutive quarters.
We've had callers to the show talking about how the trucking industry has been down.
Yep.
The Baltic Dry Index is down.
Yep.
And the fact that we just had a slight bump in the fourth quarter, the holidays. If we would have had another 1.9% quarter, that would have qualified as a recession. And we're going to get that again in this first quarter of this year. And so the problem is with the interest rates so low, there's nowhere to go in the bond market. The stock market is coming down. There's nowhere we can't cut taxes again. This is the same play that the Republicans did on us with the Bush administration. And then they talk about, socialism will just ruin the economy. Wait a minute.
Right.
Well, we've been through this. We've read this book before.
Yeah, I'm with you. Paul, well said. Thank you very much. As always, Sam in Stone Mountain, Georgia. Hey, Sam, what's on your mind today?
How are you doing, you and your staff? I hope you're well.
We are all well so far, knock wood, and thank God. What's on your mind, Sam?
I was listening to Mr. Potter. What he said was very true. I have insurance, and I got ill, and I wasn't working, and I'm on Social Security, and I got ill, and I have to pay a copay. And my wife was telling me, go to the doctor. I didn't have enough money to pay the copay.
Right.
And I said, no, I don't want to do that because I either have to pay for my medicine or pay for the copay when I go. And she kept telling me to go. And I got worse. In 2-3 days, I lost weight. 2-3 weeks came up. I couldn't take it no more. When I went, the doctor said I had the flu at first. Then it turned to pneumonia.
Right.
And so it got, just made things worse because I couldn't go to the doctor with this copay.
Right.
And what I'm saying is I don't, even being on Social Security, if I had $500 more added into my Social Security, it wouldn't be no problem.
Right.
But when you living, on your means, and I can't work anymore because of another sickness I was under, I had to let my car go because I can't work no more.
Yeah, and Bernie and Warren want to raise your Social Security payments by $1,800 a year, which is not a lot, but it's a start.
But it'll be a big
and do
help.
away with the co-pays and the deductibles. I mean, you know, let's just do that.
So what had happened now, I had to let my the clinic know that I am not working, I'm not making enough money. So they did one thing for me. For 6 months, we don't have to pay a copay. I'm trying to get everything I can. When I get ill, I'm going to the doctor. I don't have to pay the copay. I can get an MRI. I don't have to pay. So that's a little help. But just imagine if we had the things that Bernie was speaking of.
Right.
Wouldn't nobody worry? You know, it wouldn't be a worry.
Right, and it's and the big problem, Sam, is going to be people are going to get symptoms of the common cold, because the common cold's going around right now. I've had 2 of them in the last 6 months, and I had the flu 2 weeks ago. You know, by common cold, I mean, you know, you get a sore throat for a couple days, your head gets stuffy for a few days. And you get a little fever. People are going to get those symptoms, and they're going to think, well, you know, I should go to the doctor and get checked and see if this is coronavirus, but I really don't want to spend that $50 copay, you know, and all the hassle, and so they won't go. And some of them are going to have the coronavirus, and they're going to be like that woman in South Korea that spread it to hundreds of people by going to church when she had the symptoms, but she didn't want to go get tested because she'd never been to China. She didn't know anybody who'd been to China, and so she thought it was impossible. She had to have a common cold, and it wasn't until she got really, really, really sick that they tested her, and then they discovered that she'd given it to more than 100 people in her church. And now you've got an entire city in South Korea shut down. So Sam, spot on. Well said. John in Westchester, New York. Hey, John, what's up?
Hi, Tom. How are you today?
I am alive and kicking. John, what's on your mind?
Yeah, we all are.
Yeah, thank God.
I mean, we're living in some really surreal times, and
yes,
you know, there are unnamed hosts out there who are really spreading some real bad rumors, and it's a shame because, you know, there's no real viable way of disclaiming a lot of these rumors.
Well, one of the most bizarre and toxic of the rumors that is being promoted over on right-wing talk radio, John, is John, I'm sorry, I'm getting feedback here, so I'm going to drop you, but your point is well taken. We need to get straight information out. One of the more toxic rumors that is being spread, and I share this with you not to continue spreading this rumor, but so you can start knocking it down, is that, well, there was a bioweapons lab in Wuhan, China, and that's where they made this virus. Well, I've seen 2 articles now I subscribe to I'm a member of the American, of AAAS, the American Academy for the Advancement of Science, and also I subscribe to Nature Magazine, and I get literally a daily email newsletter from them. There have been 2 exhaustive genomic studies where they've taken the genome of this virus and taken it apart. And it is a 100% natural virus. It was not made in a lab. This is not a bioweapon. Nobody's out to get us. This isn't, some bizarre conspiracy. This, in all probability, it came from an animal that's sort of like an anteater. It's called a pangolin, although they're not certain about that. But it came from an animal in that live animal market in Wuhan, China. And I told the story about, when Louise and I back in the 80s in both Taiwan and in where else was it? Oh, in South Korea. We were in these open air markets where they were selling monkeys and dogs and snakes and birds and rats and bats and all kinds of stuff, for food. And, it was kind of tragic, frankly, but this is a natural virus. This is what happens when humans invade spaces where humans have never been before. That's how we got Ebola. Same thing. We started going into parts of Africa that had never been inhabited by humans and stirring up bats out of their caves who had been carrying this virus for 100,000 years. And this is an old virus that has now broken out into the human population. So we just need to deal with it rationally in a public health way. We'll be back.
You're listening to Thom Hartmann. Visit thomhartmann.com for audio and video archive.
And at this moment, if somebody tries to tell you, oh, you just need aspirin or you just need vitamin C or just, nasal irrigation, we have no idea yet how to treat this. And welcome back. Thomas in Waialua, Hawaii. Am I saying it right, Thomas, on Facebook?
You just said it a little bit slow. It's Wailua.
Cool. What's up?
Well, I just wanted to discuss, I'm 70 years old, first off, and I just want to discuss this whole subject about the coronavirus and health and in general. And I want to just say that there's something that we're missing in this conversation, and that is what I consider the common sense of building your health the way it was done throughout world history, which is by getting in touch with what you need to put into your mouth, to do on a daily basis, your spiritual beliefs, whatever those are, put that all together, and you have the best resistance to any disease that there is, including the coronavirus. The reason I say that is because I said I'm 70 years old. I haven't been to a doctor for any sickness for over 50 years. I haven't taken an over-the-counter or prescription drug, zero, not one, for 50 years. I had full coverage medical insurance at the railroad for 33 years and Medicare since then, and I never, ever used it once for any doctor for any sickness. And you could say that it would be genetics, but it's not, because I have 7 brothers and sisters, and they all use doctors, hospitals, drugs, over-the-counter and prescription, and have had surgeries. It's what I did, and it's not that complicated what I did. It's that I started when I was about 20, I had a really bad case of heartburn. I was paralyzed when I woke up in the morning, and when I about a half an hour later I could move again, and I went to the city college and I asked the nurse what it was, and she asked me a few questions about what I'd been eating, and I said Kentucky Fried Chicken, and she said how much? I said, well, once a day, sometimes twice. And she said, oh, well, you just had a severe case of heartburn from the terrible oil in that chicken. So that started my journey of making food my medicine. And I know we don't have a lot of time, but I did it.
You're singing my song, Thomas. I mean, last week when we first started talking about the coronavirus on this show, I said, you probably can't prevent yourself from getting it. It's going to sweep across this country, and 3 out of 4 of us are probably going to get this thing if it's anything like flu in terms of transmissibility. But what you can do is prevent yourself from getting really sick from it. The vast majority of people who get it just have the symptoms of a cold, and the 2 simple ways to do that, or 3 simple ways to do that. Number 1, eat a lot of fruit and vegetables. Eat a diverse diet that is healthy. Number 2, go out and walk a mile or 2 every single day. Get your lymph system moving, get your blood flowing, get your body in good shape. Do a little bit of exercise. And number 3, because this is a disease that particularly attacks the lungs, if you are smoking or vaping nicotine, break that habit right now. Just plan on taking the next 6, 8, 10 days and going through withdrawal. I did it when I was 21. I know how difficult it is to quit smoking. I tried quitting numerous times, and finally when Louise got pregnant with our oldest, we both quit smoking because we just didn't want to do that to our children. But I remember, it was the most addictive thing I'd ever tried, and I had used narcotics for my back and got a little more dependent on them than I should have. I mean, I'm familiar with addiction, but walk away from it. Get rid of the tobacco and start getting healthy and start eating well, and start it today, because this thing may be coming to a town near you in the next weeks or months. And it's not too late to get healthy, and you don't have to, it doesn't have to be some insane program, just simple stuff. Hey, did you know that Hillary Clinton actually won Pennsylvania, Wisconsin, North Carolina, and Florida in the 2016 election? It's on page 92 of my new book, The Hidden History of the War on Voting. And I will be signing that book and giving a talk about it tomorrow night, Friday night, at Powell's in downtown Portland on Burnside at 7:30. And on Sunday in Chicago and Darien, Illinois at Frugal Muse Books. So be there or be square. Randy in Ottawa, Iowa. Hey, Randy, what's up?
Hey, Tom. I was listening to your conversation with Paul and your comments afterwards, and about the safety masks,
right?
All being made in China.
Well, all the ones that my friend, the dentist's supplier, the dental supply company, they're only their single source supplier was a company in China, and so they're kind of SOL. He's having to look for another supplier. But back to you, Randy.
So here's a 3M plant location in Aberdeen, South Dakota, that makes safety masks and breathing safety apparatus for the construction industry and for medical, I believe. And they normally make about 30,000 a day. And if I remember correctly, the report on television 2 days ago was the demand for those masks are 300,000 a day.
Right.
And so there might be a place to check if you for your friend that might through 3M here locally.
Well, I think he was able to find it through another surgical supply center, in D.C. But he was pretty flipped out that I mean, it's like, wait a minute, because dentists have to change the mask between every different person. So that's good. That's good to know. Thank you very much. I appreciate that, Randy. Aaron in Tacoma, Washington. Hey, Aaron, what's on your mind?
Hey, Tom, how's it going? Always good to hear your voice on the radio and inspire the whole nation here. Just wanted to follow up on the need for single-payer health care in America and the people's fears of how that's a socialist program. Not only do they not realize that we already have that with the VA, I'm a healthcare worker and work with orthotics and prosthetics, and one of our major payers is the VA. And what people don't realize is that is already a socialist plan right there, along with Medicare.
Right.
And it's the most consistent payer out of anybody. You deal with these Blue Cross Blue Shield, your Anthems, and half the time they're going to give you an authorization for, whatever kind of service you're going to do, and that authorization is never a guarantee. When you look at Medicare and the way that they actually pay, it's based off a formula. And once that formula, you can look at it on the CMS website and see if you have this diagnosis, this meets the criteria, it's got to get paid.
Right.
And there's no way that it's going to get denied on the back end like these private insurance companies do. And it's just ridiculous that people are living in this fear of society of trying to help each other out and the fear of paying a little bit more in taxes to help out everybody.
Right. All because billionaires like Charles Koch don't want to pay more taxes and think that a dog-eat-dog, raw laissez-faire capitalism jungle society is the very best thing for America.
Yes. I was just in a patient's house, and you watch these elderly people. They sit in their chairs and they watch TV. And the ads on TV when I was just in this patient's house was a Medicare replacement plan, talking about how we'll provide rides to the hospital, dental, hearing aids,
privatized Medicare Advantage. Yeah.
Exactly. And then I had to explain to that patient that all that is how do you think that those companies can afford to advertise on TV? Because they're sucking all the money out of your pocket and putting it into these advertisements to make the fat cats even richer.
Yep. Yeah. Well said, Aaron.
We definitely need a single-payer healthcare system in the United States of America, and it's way past time that we do that.
Amen.
Thank you very
Aaron.
much, Tom.
Yep. Good talking to you, Jack in Baltimore. Jack, we got 30 seconds to the end of the hour. You wanted to make a quick comment about military spending?
Well, just look at what they do. They waste all this money, and they talk about how Medicare is going to cost all this money.
Yeah,
that's crazy.
Yeah, excellent. And Trump shuts down the epidemic division, the parts of both the National Security Council and the Department of Homeland Security that are supposed to deal with epidemic diseases in the United States. He shuts them down because we just can't afford this stuff. We got to pay for tax cuts for billionaires. Really? Give me a break. Jack, well said, and thank you for keeping it short. I appreciate that. We'll be back. We're going to continue our conversation. I want to get into also Henry Wadsworth Longfellow, a little positive note for us, my favorite poem, and one that I actually recite rather frequently. It's my mantra. And what, as interest rates are going down right now, as people are fleeing to bonds, what's that going to do to our economy? Stick around.
You're listening to Thom Hartmann.
We have a special video up over at ThomHartmann.com for supporters of our program, and it's about how a letter that the IRS sent out to 3.9 million Americans saved 700 lives. And you're like, wait a minute, the IRS saved 700 lives? How did that happen? Well, it had to do with Obamacare, and it's a fascinating story. And it turns out that this analysis of this IRS mailing was actually the first time that the federal government has done a study that actually proved that people having access to health care produces fewer deaths. For every 1,648 people who got the letter, there was one fewer premature death. I'll explain the whole thing in the video. It's you know, as I said, it's available over at ThomHartmann.com for people who are regular supporters of our program, and it is really worth checking out. And it's a great ad, essentially, for a national health care system. Well, happy Thursday. We really need your help right now. Free Speech TV needs your help. I mean, our country right now is on the brink of what I think is going to be a very serious crisis, both an economic and a public health crisis. Frankly, both of them brought about by years and years and years of Republican policies. In countries with national health care systems, people are not afraid to go to the local doctor's office or the local hospital and get tested for the coronavirus. Because A, they're not going to lose money from work, because if you're sick, you get sick time in every other developed country in the world. And B, they're not going to have to pay for the damn test, because in every other developed country in the world, you get medical tests and things like that with no copay and no premium. You don't have to pay a copay for your doctor's office. You don't have to pay for the test. In the United States, this test could cost, if you show up at a hospital emergency room, could cost as much as $5,000. People aren't going to do it. People aren't going to take time off from work, and that's going to make the situation worse. And this all goes back to politics. This all goes back to 40 plus years of Reaganomics and I mean, all the way back to Medicare, for example. When Lyndon Johnson passed Medicare, he wanted it to cover 100% of the costs of elderly people over 65. And what back then was called elderly. And the Republicans said, oh, no, you can't do that. People have to have skin in the game. Otherwise, they'll use too much of the resource. This was their excuse. And so they said, OK, we'll have it pay 80%. You can have private health insurance cover 20%. Over LBJ and the Democrats' objections, the Republicans forced that through. That was the price that they demanded to have Medicare. And, you know, it's the same thing with the health insurance companies. They're saying, oh, well, you got to have some skin in the game. You got to pay the first, $20 for when you go to see your doctor, or $50 or whatever it may be, and the first $5,000 of all medical expenses. You know, the average American has to pay $4,000 a year if they have an Obamacare policy out of pocket. That's crazy. Most Americans don't have $4,000. So this is just going to make things worse. And it's all, as I said, it's all about politics. And where are you hearing that? In an honest and straightforward fashion here on Free Speech TV, which is why Free Speech TV needs your help right now. If we're going to fix these problems that have been created by a century of neoliberal, libertarian, Republican, conservative economic and political policies, if we're going to fix these, we need to have honest conversations about them. And those conversations happen here. They happen here on this program. They happen here on this television network. So please call now, 877-378-8669, and support the Thom Hartmann Program and support Free Speech TV. It matters. It really matters. Your $5 a month donation really matters. Your $10 or $15 a month donation really matters. So please call now, 877-378-8669. With a $20 gift, you get the proud student of Thom Hartmann University bumper sticker, or a car magnet to get the vote out. The car magnet says, I'm voting, are you? Right, there you go. With a $50 gift, you get the Just Effing Vote canvas tote bag. We need to be telling everybody, hey, vote. It's important. With $75 gift, you get a great coffee mug to wake you up in the morning. It's the Thom Hartmann Tag You're It coffee mug. And I'm going to have to call up Free Speech TV and make a contribution and get one of those things. With a $240 gift or $20 a month for a year, you can participate in our virtual meet and greet. We do these a couple times a year where we get 4, 5, 6, 8 people together, all on Skype or Zoom or whatever it is they happen to be using. And, you can see me and hear me, and I can hear you, and if you want to turn your camera on, I can see you. And we'll just have an off-the-record conversation about whatever's on your mind. And some of these are absolutely fascinating. In fact, most of them are. With a $300 gift, we've got the Get Out the Vote pack, and that is a set of Free Speech TV host postcards to send out to your friends and family. Tell them about your favorite shows on Free Speech TV. The car magnet to get out the vote. I'm voting are you, to get the Just Effing Vote tote bag, and, excuse me, my new book, The Hidden History of the War on Voting. That's with a $300 gift. With a $360 gift or $30 a month for a year, you get all 3 of the Hidden History books that are out now. The Hidden History of Guns and the Second Amendment, The Hidden History of the Supreme Court, and the most recent one, The Hidden History of the War on Voting, all autographed by the author. With a $1,000 gift, you can come to Portland and hang out in our studio, and we'll sit here in our peanut gallery. We'll go to lunch down the street, and we'll have a nice time. So that's with a $1,000 gift. So those are the premiums that Free Speech TV is offering, and that our show is offering. But the bottom line is that information is currency. Information is wealth. Information. Knowing things is arguably a form of wealth. It is a form of, it empowers people. It empowers you. Actually knowing what's going on, as opposed to just hearing the blather that's coming out of corporate media, who's up, who's down, what's the game, what's the sports. Let's talk about the real issues. We do that here. And it's important stuff. So call now, 877-378-8669. Thank you so much. Please call now. Would participate with an uncontainable force in building the new society. The book, Cuban Women Confront the Future by Vilma Espin.
This is the Thom Hartmann Program.
Welcome back. Thom Hartmann here with you. Wanted to share, all of us have things that kind of keep us up, right? For me, it's among them is taking a walk, trying to get out in nature, walking through. There's a park down the street from where we live. We're nearby the Columbia River. Louise and I try to walk along the river every morning for a mile or so. Those are things that do it for me, saying prayers for my friends and family and even my enemies and my president seems to do it for me. As skeptical as I am about any, Bronze Age sky god doing anything, I subscribe to the Christian Science notion that we're all connected somehow, and that when you pray for somebody, you actually are sending a good energy their way. I pray for my staff here. I pray for all kinds of folks. But I do it because it makes me feel good, right? I think it's doing some good. And one of the things that has really been a constant through my life is a poem I learned when I was in high school. And I just wanted to share it with you because I think it's an inspiration for all of us now. And then I want to get into some economic stuff, and then we'll get back to coronavirus and your phone calls. It's by Henry Wadsworth Longfellow, and it's called A Psalm of Life. And the subtitle is What the Heart of the Young Man Said to the Psalmist. Tell me not in mournful numbers that life is but an empty dream, for the soul is dead that slumbers and things are not what they seem. Life is real, life is earnest, and the grave is not its goal. Dust thou art, to dust returnest was not spoken of the soul. Not enjoyment and not sorrow is our destined end or way, but to act that each tomorrow finds us further than today. Art is long and time is fleeting, and our hearts, though stout and brave, still like muffled drums are beating funeral marches to the grave. In the world's broad field of battle, in the bivouac of life, be not like dumb driven cattle. Be a hero in the strife. Trust no future, howe'er pleasant. Let the dead past bury its dead. Act in the living present, heart within and God o'erhead. Lives of great men all remind us we can make our lives sublime, and departing, leave behind us footprints in the sands of time. Footprints that perhaps another, sailing o'er life's solemn main, a forlorn and shipwrecked brother seeing, shall take heart again. Let us then be up and doing with a heart for any fate, still achieving, still pursuing, learn to labor and to wait. It's just an absolutely brilliant poem, and I hope it's meaningful to you. I don't, maybe I just did, a minute and a half of schmaltz that, was useless, but it was important to me. Some things that are going on in the world that I think you ought to know about. In Scotland, there's a law that says that if somebody buys Scottish property, whether they're a Scottish citizen or not, and they can't prove that, where the money came from, if there's a suspicion that the money might be the result of illegal money laundering, Scotland, the country, can seize their property. And a lawmaker in Scotland, he's a member of the Scottish Parliament, his name is Patrick Harvey, MSP, member of Scottish Parliament, Patrick Harvey, says that, quote, there are reasonable grounds for suspecting that the U.S. president or people he is connected with have been involved in serious crime. And so he is seeking what's called an unexplained wealth order, which is the Scottish government legal term for prove that you got this money legally. Because he says that the U.S. president, quote, bankrolled his multi-million-dollar acquisition of land and property in his mother's homeland, in a way that he thought might be inappropriate. The Scottish government can seize your property, quote, if suspected corrupt foreign officials or their families cannot show a legitimate source for their riches. Fascinating. Number one. These are just basically data points to share with you, the news of the day. A poll just came out from Muhlenberg and McCall. These are a couple of polling companies working together, put together this poll of head-to-head matchups between Democrats and Trump in 2020. Just asking registered voters in Pennsylvania. Trump beats Bloomberg by 3 points, 48 to 45. Trump beats Buttigieg by 1 point, 46 to 45. Trump beats Klobuchar 1 point, 45 to 44. Trump ties with Warren, 47 each. Trump ties with Biden, 47 each. Bernie Sanders beats Donald Trump by 3 points in Pennsylvania, 49 to 46. I keep telling you, this campaign is not about left and right. It's not about socialism or capitalism. It's about insiders and outsiders. And Americans, they wanted an outsider, and they got one in the White House, and now they're discovering he's not the kind of outsider they want. And Bernie's an outsider, and that's, that, in my opinion, that is going to be what this entire election is all about. I believe I mentioned this in the first hour, but there was a testimony yesterday in the House of Representatives before the House Energy and Commerce Committee. And Alex Azar, who used to be the head of Lilly, Eli Lilly, the pharmaceutical company, he oversaw doubling the price of insulin for Americans. Bernie Sanders said, under the Trump doctrine, if you're wealthy, you can buy a vaccine and not succumb to the sickness. And, that's unacceptable. So Jan Schakowsky was on the committee. She's in the House. She's a Democrat from Illinois and one of the best progressive Democrats out there. If you're in Jan Schakowsky's district, and I know many of you are listening to me right now, you are blessed. And so she said, are you going to keep the price of this vaccine that we are all helping to pay to develop through the National Institutes of Health, but will be manufactured and sold by one of these for-profit drug companies? Are you going to keep that price low enough that everybody can afford to get it? And Alex Azar said, and I quote, we would want to ensure that we'd work to make it affordable, but we can't control that price because we need the private sector to invest. She gave Azar 3 chances. In fact, these are Schakowsky's words. I gave us our 3 chances to assure us that any coronavirus vaccines or treatments developed with U.S. taxpayer dollars would be affordable and accessible to everyone, and he flat out refused to do so. He's giving Big Pharma a blank check to monopolize them instead. This is what happens when you put a Big Pharma CEO who doubled the price of insulin in charge of regulating Big Pharma, which is that last sentence was from Social Security Works, Alex Lawson's group. Louise just called me during the break. She had her annual physical this morning. You know, we both had the flu 2 weeks ago when we were on vacation, and she still has something going on in her lungs. And her doctor, as part of the physical, said, you know, you still have some congestion in your lungs, so we need to get you an inhaler so you can just kind of open that up because the coronavirus is coming and we want to get you as healthy as possible. You're over 60. And also, she had an ear infection. And so she goes to the pharmacy, and you know, we're on Medicare, but the pharmaceuticals are actually paid for by private health insurance by private insurance companies that just do drugs. And this is Medicare Part D. It's not actually Medicare. Medicare doesn't pay for your drugs. It's a private company, and you have to figure out which private company you want. And so they phoned in her prescription and for the eardrops, which was like $80, and the inhaler, which was over $100. And the insurance company said, no, we won't pay for it. So the pharmacist said, that happens 9 times out of 10 with these insurance companies, these for-profit insurance companies, and most people simply leave without the inhaler or without the drops for the infection. And they just hope that they'll get better. And Louise said, well, you know, is there any other way to do this? And so he called the doctor, and the pharmacist said, these eardrops are a quinolone drug, Cipro, basically, in a saline solution. And he said there's an identical product for eyes, but more people get it for the eyes, for pink eye and things, than they do for ears. And so the eye one is only like $20, whereas the ear one is $80, but it's the exact same thing. But I have to get your doctor's permission to give you eye drops for your ears. So he called the doctor, and she said, okay, fine, I'll change the prescription. So that was taken care of. And then there's this, $120 inhaler. And, what do you do about the inhaler? Well, they went on to GoodRx, and they found a coupon for another brand of inhaler on an app that was $45. And again, Louise had to pay for that out of pocket because the insurance company, the for-profit insurance company that administers Medicare Part D, wouldn't pay for it. This is just nuts. This is nuts. I mean, we're fortunate in that, we've had a good run in our life, and we've made some money here and there, and we've got a little bit stashed away, and we can afford to spend $100 for pharmaceuticals. I don't think most Americans can. Half of America can't deal with a $400 expense at any point during the year. 70% of Americans are living paycheck to paycheck. 60% of Americans can't deal with a $1,000 expense. And this is how, this is our healthcare system? This is just crazy. It's just absolutely crazy. By the way, speaking of the coronavirus, this is one of those, And again, I'm not trying to upset or panic anybody. I just think it's really important that we have good information, honest information. Donald Trump was lying through his teeth last night, and everybody knows it, which is why the stock market is still collapsing. But here's this. This is from Reuters. The news agency. This is Dateline Tokyo. A woman working as a tour bus guide in Japan tested positive for the COVID-19 virus for the second time. She's the first person in the country to be reinfected. She had it on February 1st. She was discharged from the hospital after fully recovering and testing negative. And now here we are, February 26th, 4 weeks later. She got sick again, and they tested her, and sure enough, it was coronavirus. She got it all over again. And who do we have in charge of our effort to deal with this? Mike Pence, the guy who in 2000 said tobacco doesn't cause cancer, the guy who, when he was governor of Indiana, and there were 20 cases of HIV being spread by dirty needles in a rural county, said, no, we're not going to have a needle exchange program. That wouldn't be biblical. And 200 people ended up with HIV in that county as a result of Mike Pence doing that. And they didn't know they had it because Mike Pence had cut all funding for Planned Parenthood in Indiana. So the Planned Parenthood clinic, which was the only place you could go to get tested for HIV, was shut down. That's the guy in charge of our coronavirus response. The guy who said that women, he actually got a law passed. It didn't, it got challenged in the courts and got stopped. But it said that if women miss their periods, they have to report themselves to the police so that they can monitor whether or not they're going to have an abortion. And if you have a miscarriage, you have to report it to the police, and you have to have a funeral. That's Mike Pence. That's the guy who's in charge of coronavirus.
This is the Thom Hartmann Program.
Are you a little concerned? I am, more about our government, frankly, than about the damn virus. We'll be back. And welcome back. Bob in Burien, Washington. Hey, Bob, what's on your mind?
Good morning, Tom. Honored to speak with you. Quick question about your book on the Supreme Court.
Right.
The Seattle Times this morning, they do a little piece every day called Today in History.
Mm-hmm.
And this morning they had a little blurb. 1922, the Supreme Court in Lesser versus Garnett unanimously upheld the 19th Amendment to the Constitution, which guaranteed the right of women to vote.
Right.
Does this imply that the Supreme Court has judicial review over ratified amendments to our Constitution?
Apparently. I didn't know that, Bob. It's pretty shocking,
Does that mean
actually.
they also have the judicial review over the Constitution?
Well, they ultimately do, because they can interpret the Constitution any way they want. I mean, the Second Amendment, nowhere does it say that there is an individual right to own weapons. It's in the context of a militia. And it was interpreted that way right up until, whatever the year was that the Heller decision was passed down, when Scalia found that individual right in the writings of some anti-federalists back in the 1790s. So the Supreme Court, they discovered in the 1880s that there was the corporations were persons in the Constitution. It doesn't say that in the Constitution. There's been no shortage, and my book is full of a list of them. The Constitution doesn't say that you can't have a union, but they've destroyed unions based on their interpretation of the Constitution. So because of judicial review, the Constitution says whatever the Supreme Court says it says, period, full stop. Unless Congress were to step up, like I talk about in one of the very last chapters in the book, unless Congress were to step up and start passing legislation that specifically prohibits the Supreme Court from reviewing their legislation.
So does that imply that move to amend, if it were to be ratified, would be up for review again?
Yes. Yes. I find it hard to believe that the Supreme Court would knock down a constitutional amendment that had been passed by 2/3 of the House and Senate and 3/4 of the states. But given the people that Donald Trump is putting on the Supreme Court, I put nothing past him. Bob, thanks for the call. Donna in Lincoln, California. Hey, Donna, what's on your mind?
Well, I just wanted to mention that there are natural antibiotics, herbs that work amazingly well, and I've used them for like 23 years, and I haven't had a cold. The 2 times I got a cold, I didn't realize I was sick for a couple of days.
Black elderberry. It's a natural antiviral, and there's actually good science that shows that it prevents the common cold. And so I have a bottle of black elderberry capsules here that I've been taking, Nate's been taking, Sean's been taking, along with a big bottle of vitamin C.
There are other ones, but that's the one. I mean, they're wild all over the place anyway.
Yeah.
But I'm starting to see them in pharmacies, but it's like a quarter of a cup for $22. But
Right.
it's wild all over the place.
Yeah.
Anyway, thank you so much. I'm hoping that maybe some people will really look into some natural antibiotics.
Well, these are natural antivirals. But yes, your point made, Donna, and excellent. It doesn't mean that it's going to have any value against the coronavirus, but the common cold is a coronavirus. So, I stocked up on black elderberry. I'm just, better safe than sorry. And you're talking $15 for a bottle, of herbs. And again, going through what Luis just went through at the pharmacy, I get it. That's a lot of money for some people, but we actually put this on the company budget. I don't know if the IRS will come after us for that or not. I think that's legal. I think that's considered health care. We'll be right back. Our 1-hour free podcast recaps our show, and it's available wherever fine podcasts are found. And we have the full 3-hour podcast available over at thomhartmann.com if you want to really support our program. Welcome back. Thom Hartmann here with you. Steve in St. Genevieve, Missouri. Hey, Steve, what's on your mind today?
Hi, yeah, I was just reading some information out of one of the Spokane newspapers up there. And the man that was in Snohomish County, the man who, the first U.S. citizen to get coronavirus, he made a full recovery. And they're saying that one of the factors are they gave him an experimental drug called remdesivir.
Yeah, it's an antiviral drug.
That's right. That helps HIV patients block the virus from replicating in the body.
Correct.
So evidently, there are some people out there that are smart that are working
There are
on it.
4 different antiviral drugs that they're testing right now that I know of, and that's one of them. Another one is is Tamiflu. I don't recall the actual chemical name of it, but the one that is used for flu. And then there are 2 others that I can't remember the names of, and I'm not familiar with, but they all kind of end with VIR because they're antiviral drugs. And they're doing tests where they're testing this one against that one, and not so much in the United States, but these tests are being conducted in China, they're being conducted in Europe, and my guess is that within the next 6 months we'll have a good handle on what antiviral drugs are actually effective against this coronavirus.
This is actually being tested from the University of Washington. School of Medicine.
Good. Well, they've got to have a certain. I mean, if they must be using either tissue culture or an animal study then, because we don't have enough people infected with coronavirus in the United States to do a good test on an antiviral drug. But they certainly do in China.
There's a lot of antiretrovirals out there. If you've been keeping track of medication coming out of the AIDS community.
Yeah, there you go.
So there's a lot that they can actually work on to actually get something probably sooner rather than later.
I agree, Steve, and it's one of the things that keeps me optimistic. Steve, thanks for the call. Fran in Florida, Massachusetts has a town called Florida. I didn't know that. Fran, what's up? We just have a minute to the end of the hour, or the end of the break, to a break.
Hi, Tom. Concerning the mask, filtering mask used for this coronavirus. I got mixed feelings on this. I heard a commenter this morning. Basically, the basic mask is like paper, and it really doesn't protect the person from getting the virus, but it does stop from spreading the virus when they cough.
That's correct. If you're going through an airport and you're looking at and you see mostly Japanese people. This is like a cultural thing in Japan. You'll see Japanese people walking through an airport, through an international airport. I saw it in San Francisco last week, walking through the airport, and they're wearing face masks. They're not wearing the face mask because they're afraid of getting something. They're wearing the face mask because they have the symptoms of the common cold. They've got a flu or a cold or something like that, but they have to be out in public, and so they wear the face mask so as not to spread it. It's a sign of respect to other people, and it's a good thing. And we should have long ago adopted a similar thing in the United States. So, a mask isn't going to be that effective at preventing you from getting the coronavirus, but it will prevent you from spreading it, which is an important thing. Fran, I got to run, but thank you for the call. You're spot on. Well said, all that kind of stuff. It's 27 minutes past the hour. We'll continue our conversation. I also want to talk, I never got to this, about the impact of low interest rates. I just want to touch on this after the break because I am concerned about the economy. And I think we're hitting that point that I wrote about in my book, The Crash of 2016.
You're listening to the Thom Hartmann Program. Call 202-808-9925.
We'll be right back with more of the news of the day and your calls right after this. Stick around. Well, happy Thursday. We really need your help right now. Free Speech TV needs your help. I mean, our country right now is on the brink of what I think is going to be a very serious crisis, both an economic and a public health crisis. Frankly, both of them brought about by years and years and years of Republican policies. In countries with national health care systems, people are not afraid to go to the local doctor's office or the local hospital and get tested for the coronavirus. Because A, they're not going to lose money from work, because if you're sick, you get sick time in every other developed country in the world. And B, they're not going to have to pay for the damn test, because in every other developed country in the world, you get medical tests and things like that with no copay and no premium. You don't have to pay a copay for your doctor's office. You don't have to pay for the test. In the United States, this test could cost, if you show up at a hospital emergency room, could cost as much as $5,000. People aren't going to do it. People aren't going to take time off from work, and that's going to make the situation worse. And this all goes back to politics. This all goes back to 40 plus years of Reaganomics and I mean, all the way back to Medicare, for example. When Lyndon Johnson passed Medicare, he wanted it to cover 100% of the costs of elderly people over 65. And what back then was called elderly. And the Republicans said, oh, no, you can't do that. People have to have skin in the game. Otherwise, they'll use too much of the resource. This was their excuse. And so they said, OK, we'll have it pay 80%. You can have private health insurance cover 20%. Over LBJ and the Democrats' objections, the Republicans forced that through. That was the price that they demanded to have Medicare. And, you know, it's the same thing with the health insurance companies. They're saying, oh, well, you got to have some skin in the game. You got to pay the first, $20 for you when you go to see your doctor, or $50 or whatever it may be, and the first $5,000 of all medical expenses. You know, the average American has to pay $4,000 a year if they have an Obamacare policy out of pocket. That's crazy. Most Americans don't have $4,000. So this is just going to make things worse. And it's all, as I said, it's all about politics. And where are you hearing that? In an honest and straightforward fashion here on Free Speech TV, which is why Free Speech TV needs your help right now. If we're going to fix these problems that have been created by a century of neoliberal, libertarian, Republican, conservative economic and political policies, if we're going to fix these, we need to have honest conversations about them. And those conversations happen here. They happen here on this program. They happen here on this television network. So please call now, 877-378-8669, and support the Thom Hartmann Program and support Free Speech TV. It matters. It really matters. Your $5 a month donation really matters. Your $10 or $15 a month donation really matters. So please call now, 877-378-8669. With a $20 gift, you get the proud student of Thom Hartmann University bumper sticker, or a car magnet to get the vote out. The car magnet says, I'm voting, are you? Right, there you go. With a $50 gift, you get the Just Effing Vote canvas tote bag. We need to be telling everybody, hey, vote. It's important. With $75 gift, you get a great coffee mug to wake you up in the morning. It's the Thom Hartmann Tag You're It coffee mug. And I'm going to have to call up Free Speech TV and make a contribution and get one of those things. With a $240 gift, or $20 a month for a year, you can participate in our virtual meet and greet. We do these a couple times a year where we get 4, 5, 6, 8 people together, all on Skype or Zoom or whatever it is they happen to be using. And, you can see me and hear me, and I can hear you. And if you want to turn your camera on, I can see you. And we'll just have an off-the-record conversation about whatever's on your mind. And some of these are absolutely fascinating. In fact, most of them are. With a $300 gift, we've got the Get Out the Vote pack. And that is a set of Free Speech TV host postcards to send out to your friends and family. Tell them about your favorite shows on Free Speech TV. The car magnet to get out the vote. I'm voting, are you? To get the Just Effing Vote tote bag. And, excuse me, my new book, The Hidden History of the War on Voting. That's with a $300 gift. With a $360 gift, or $30 a month for a year, you get all 3 of the Hidden History books that are out now. The Hidden History of Guns and the Second Amendment, The Hidden History of the Supreme Court, and the most recent one, The Hidden History of the War on Voting, all autographed by the author. With a $1,000 gift, you can come to Portland and hang out in our studio. And, we'll sit here in our peanut gallery. We'll go to lunch down the street, and we'll have a nice time. So that's with a $1,000 gift. So those are the premiums that Free Speech TV is offering and that our show is offering. But the bottom line is that, information is currency. Information is wealth. Information, knowing things is arguably a form of wealth. It is a form of, it empowers people. It empowers you. Actually knowing what's going on, as opposed to just hearing the blather that's coming out of corporate media, who's up, who's down, what's the game, what's the sports. Let's talk about the real issues. We do that here. And it's important stuff. So call now, 877-378-8669. Thank you so much. Please call now. Life, liberty, health, limb, or goods. It's the hidden history of the Supreme Court and the betrayal of America by Thom Hartmann. Coming up in the Science Revolution this week, I explain why biodiversity matters and what happens when we lose biodiversity. Margaret Butler from the Extinction Rebellion is here about the activists fighting against oil trains and what happened to them. Dr. David Reichmuth also joins me on the impact of electric cars and find out why people are adding mushrooms to their coffee. That's the Science Revolution, wherever fine podcasts are available. And tomorrow night I'll be talking about, why it's so important to vote and how they're trying to steal your vote. But we need to get these bums out of office. Tomorrow night at Powell's at 7:30 here in Burnside in Portland. And Sunday at noon in Darien, Illinois at Frugal Muse Books. So that's what's going on there. And, I was going to mention the economy. As people are bailing out of the stock market, they're bailing into the bond market. They're buying TLT and all these variations on exchange-traded funds, ETFs, that are invested in U.S. government bonds, as well as other bonds. You see municipal bonds and state bonds and all kinds of corporate bonds. All kinds of bonds are going up in price and value because they're going down in terms of the interest rate that they pay, because the more demand there is for the bond, the less interest they have to pay. It's a weird kind of upside down, this for that, but that's how it works. And so what's happening right now is that if just the reduction in interest rates we've seen just in the last few weeks as a result of the collapse in the stock market, if those stand, you could see mortgage interest rates go down by as much as a full percentage point 6 months or 9 months down the road. And they may go down even more. And what this does is it causes the price of housing to go up. Because when people are looking at buying a house, they're not looking at, can we afford $100,000 for this house? They're looking at, can we afford $300 a month for this house? And as the interest rates go down for that $300 a month, right now you might be buying a $100,000 house, but if the interest rates drop another point, that might be a $120,000 house. So what happens is everybody who has a $100,000 house for sale starts charging $120,000 for it because, now the same people are eligible to buy it. And this is the thing that over the last, since 2008, over the last 10, 12 years, has been driving the explosion in housing prices, which is also driving the explosion in homelessness and in people who are living, way below where they should be in terms of housing. And it's not just housing. It'll also make it easier to lease a car, rent a car, lease a car, buy a car on time. Buy a car, through a bank, but leases are the typical ones. And along with that, and it probably won't affect credit card interest rates because they're as high as they can get anyway. You already get screwed with credit cards. But, bottom line with all of this stuff is that there is this debt bomb. We have more consumer debt than we have ever had in the history of this country. We have more government debt than we've ever had in the history of this country. We have more corporate debt than we've ever had before in the history of this country. And the only thing that is preventing any of those three from blowing up in our face is that interest rates are down, well below 2%, and in some cases in the neighborhood of 1%. If those interest rates start rising back to normal, which is 2 to 5%, if they start rising back up to normal, those debt bombs are going to explode. And every year that goes by that we maintain these low interest rates, we're going to see an increase in housing prices and thus indebtedness. We're going to see an increase in the number of people who are buying cars who really shouldn't be buying new cars. By the way, the subprime car market and the subprime mortgage market right now, literally this moment, and the subprime student loan market, these are all, people who got loans who have low credit ratings. And they're literally called subprime markets. Those three markets, housing, cars, student loans, in the subprime area, are at all-time highs in terms of defaults, which is a warning signal. That's the canary in the coal mine just knocking over unconscious. So get ready. It's coming. It's coming without the coronavirus. And obviously, the stupid response of the Trump administration to lay off and fire and shut down the entire departments in Homeland Security and National Security Council that deal with pandemic diseases, because we have to save money because we got to pay for those billionaires' tax cuts, and also diverting money away from the Centers for Disease Control to Trump's wall. I mean, all this stuff is just really helping us out, isn't it? Aurelio in Santa Fe. Hey, Aurelio, what's up?
Hello. I haven't talked to you in about 6 years. When I lived in Santa Fe, New Mexico, I live in Corrales, New Mexico. Now it's a village or a town of 5,000, about 20 miles out of Albuquerque.
Oh, great.
And I want to talk about socialism. And somehow I'm just getting sick and tired of how people don't understand. I'm a Bernie supporter, and I'm sure I've heard it on your radio before because I listen to you all the time. And socialism is all around us. If Bernie implements those programs, it's going to be capitalism plus. That's all there is.
Yeah.
It's going to increase.
As they do all over Europe.
It's going to lower the debt.
Yeah.
All kinds of other positive things that are going to happen.
Yes.
Is there any way that Bernie gets a word or an aide or somebody tells him what socialism really is?
Bernie knows all about this, and I think most of Bernie's supporters get it. And what we're dealing with right now is a news media that's sadly and badly misinformed, and a bunch of billionaires and right-wing crackpots, and a few people who want to be president and don't want Bernie to be president, who are promoting basically a scam that somehow what Bernie is suggesting is not consistent with the American way. Bernie is suggesting exactly what Franklin Roosevelt, Harry Truman, Jack Kennedy, and Lyndon Johnson suggested. It's only in the modern era. We've only had two Democratic presidents since 1930 who were, and actually only one, Bill Clinton, who weren't trying really, really hard to get health care for every American. Barack Obama even tried it and succeeded until the Supreme Court took it apart in getting health care for everybody. So I'm with you, Aurelio. Thank you for the call. Ruth in San Bernardino Mountains, California. Hey, Ruth, just lost Ruth. I guess she just hung up. Terry in Eugene, Oregon. Hey, Terry, what's on your mind?
Hey, Tom. You mentioned a couple days ago how if Trump loses the election, he could potentially get Pence or the House of Representatives to argue that, which then would lead to the states having an individual vote.
Yes.
Could you touch on that? Like, how do we prevent that from happening? Because that seems
it's in the Constitution, and then it's slightly fine-tuned and restated in the 12th Amendment to the Constitution. And the bottom line is that every state has the power to define how their electoral votes are allocated, and which is how the Interstate Compact would work. There's this deal of where each state. I think they're up to 170 some odd electoral votes. They have to hit 270. But when enough states are part of this compact, then what they're committing is they will commit their electoral votes to whoever wins the majority in the election. And, and nationalpopularvote.com is the website for information on that. But that's the good side of it. The bad side of it is what happened in Florida in 2000, where the state legislature in Florida was prepared to pass a law that said that the Florida electors were going to go for George W. Bush, regardless of what the recount that had been mandated by the state Supreme Court said. No matter what the recount said, we're going to give our votes to George W. Bush. States have the power to do this, and it's the legislature of the states, not the governors, who are given that power by the Constitution. So if, say, Wisconsin is the state that everything turns on, for example, or Wisconsin and Michigan, for example, both of these are states that have Republicans controlling their legislatures, even though they have Democratic governors. If Donald Trump was to start yelling, there's all kinds of voter fraud going on in Wisconsin and Michigan, and here's some evidence, and Fox News, finds, some guy who shouldn't have voted and says, here's the proof, and it turns into a Kate Steinle thing where Sean Hannity is repeating it like he's got a tick. Then the Republican legislatures in those two states could simply say, we're going to allocate, even though the majority of our voters said that they wanted Bernie Sanders or whoever it is, Mike Bloomberg or whatever, whoever the Democratic nominee is, their legislators could say we're going to go with Donald Trump. There is some debate about whether this needs to be certified by the vice president. I'm trying to find out if that's a tradition or if that's in law, because Pramila Jayapal was telling me last week how she tried to get Joe Biden not to certify the election. The Constitution says that the president of the Senate, the vice president, shall count the votes from the electoral votes from the states. Doesn't say whether in the process he is declaring them to be, honorable or not, or whatever the term is. So anyhow, that's
a scary scenario. Hard to keep hope.
It is, and I know that there actually is conversation about this happening in Republican circles right now, so we need to get ready for it. Terry, thanks for the call. Greg in Tacoma, Washington. Hey, Greg, what's up?
Hey, Tom, good talking to you.
Hey,
my concern is that it's an inept administration, but there's a lot of people that are really forward thinking. They're thinking long game. And they may think that they can protect themselves from this virus, and this might be a good way to nullify election or not even have an election at all.
Yes, declare a state of national emergency under the Patriot Act and suspend, not suspend, but postpone the election. Yes. I am very concerned about that, and I keep asking, I asked Mark Pocan this on Wednesday. He said he's going to look into it. Does the Patriot Act actually give him that authority? I've heard answers that say yes, and I've heard answers that say no, and I am not enough of a scholar of the Patriot Act to know the answer.
Yeah.
But it's troubling.
Yeah, because this is not going to just kind of piddle along. It's going to take off and go. When it goes, exponential, look up what exponential means.
Yeah.
And it's going to go really fast.
No, you're going to see, 1 week you're going to have a couple hundred cases in the United States, and the next week it's going to be a couple thousand, and then the week after that it's going to be tens of thousands, and then, maybe a month down the road it's going to be hundreds of thousands or even millions. That's how it happens, and particularly since we don't have the systems to deal with it, it's going to be problematic. Greg, thanks for the call.
Listening to Thom Hartmann. Visit thomhartmann.com for audio and video archives.
We'll be back. It's 45 minutes past the hour here on the Thom Hartmann Program. Welcome back. Anthony in Detroit. Hey, Anthony, what's on your mind? Thanks for watching us on YouTube. What's up?
Hey, thanks for taking my call. I just wanted to make like a bigger picture point, in my view, about the discussion around healthcare, and what I ran into is I've been trying to nail down my senators about whether or not they support Medicare-for-all. They're both Democrats, but their offices, they can't give you a straight answer, and it also it plays into this thing where I see them talking about, we want universal coverage. I'm like, well, universal coverage is a goal, not a policy. And it's like, is your policy a patchwork of, it's just the discussion.
Yeah, your senators are, Peters and Stabenow?
Yeah.
Yeah. So Peters is pretty progressive. I'd be surprised if he said no. Stabenow, has always been, more of a Clinton kind of corporate Democrat. So it doesn't surprise me that she's not supporting Medicare for all. Although she probably will if Bernie's at the top of the ticket. I have a feeling a lot of Democrats are going to fall into line. We'll see. This may be wishful thinking, but we'll see.
Yep.
Anthony, thanks a lot for the call. It's good to hear from you.
Thank you. Thank you.
Sure. Deborah in Denver watching us on YouTube also. Hey, Deborah, what's up?
Hi, Tom. I have 3 questions, but they're all related to the corporation as a person and Citizens United. First, if a corporation is a person and a person is limited to $2,800 to a particular campaign, shouldn't a corporation be limited to $2,800 as well? And
actually,
we lower?
I think I'm not that conversant in election law right now to know how corporations can support individual candidates. It used to be that it was illegal. The Tillman Act of 1907 made it illegal for any corporation to give money to any candidate's campaign for federal office. And a number of states had made that illegal. I believe that Citizens United blew that up, but I don't know what limits might be in place. But the way they get around it is very simple. They just give money to a super PAC, and that's unlimited, just like it is for billionaires.
Well, I know that Citizens United basically says you cannot restrict spending completely, doesn't it? That's just basically what you just said.
From quote, non-affiliated groups, end quote, which is the super PACs, yeah.
Well, how about this then? Couldn't we lower the limits drastically for contributions to parties, too?
We could. It would require legislation. I don't see that happening any day soon, but, you could.
So they are getting around it by giving to super PACs, but couldn't we at least close the gap of if a person is a corporation, and I mean, if a corporation is a person, they're limited to $2,800.
Right.
Hold them accountable to that they can't donate more than $2,800.
We have to figure out how to get our hands around all this dark money, and it's becoming more and more complicated by things like social media every day. The way that they do it in the UK and many of the European countries is that elections only last 8 weeks. What
do you think is a good solution for getting for holding super PACs accountable?
Well, the solution that the Supreme Court came up with in Citizens United was transparency. They have to disclose, 6 months after the fact, they have to disclose who gave them over a certain amount of money. It's a couple $1,000s, and where that money went. But I think that that's just a fig leaf. We really need comprehensive election reform here in the United States. We need to go to publicly funded elections and just say nobody can spend money on elections except unless it's public funds. Deborah, thank you for the call. We'll be right back. Hey, did you know that Hillary Clinton actually won Pennsylvania, Wisconsin, North Carolina, and Florida in the 2016 election? It's on page 92 of my new book, The Hidden History of the War on Voting. And I'll be signing that tomorrow night at Powell's and Burnside at 7:30 and Sunday afternoon at noon at Frugal Muse Books in Darien. Nancy in Minneapolis. Hey, Nancy, what's on your mind today? Thanks for listening to AM 950,
Hey.
KTNF.
Thanks, Tom. I was watching Michael Moore's Capitalism, a Love Story last night, and in that he found some 9/11 rescuers who had lost their health insurance, couldn't afford money or couldn't afford anything. So he took them to Cuba, and they saw specialists. They had tests done. They got their medication, and one in particular, a woman who had been having respiratory problems, needed an inhaler, which she was being charged in the United States over $100. She got it from Cuba for a few cents. It was like 5-10 cents for an inhaler.
Right.
And she just wept. And I thought, people here are afraid of democratic socialism?
Really?
How do you like capitalism?
Right.
My God.
Yes. Excellent point. Like my story about Louise's adventure, hour-long adventure at the pharmacy this afternoon or this morning. Yeah, spot on, Nancy. Nancy, thanks you for sharing that story. That's a great one. Eileen in Pittsburgh, Pennsylvania. Hey, Eileen, what's on your mind?
Hi, Tom. I just wanted to bring up the fact of Donald Trump. He never takes responsibility for anything bad. And with this coronavirus, I'm wondering if the reason he put Pence in there is because when it goes bad, or if it goes bad, he can stand back and say, hey, I did good, it's his fault.
Well, let me extend that conspiracy theory, Eileen. I'll share with you my personal conspiracy theory, which I haven't advertised in a big way on this show because it is just that. It's a conspiracy theory. But I believe that Donald Trump wants Nikki Haley to be his running mate so that he can claim both gender and racial diversity. And Nikki Haley has been a good soldier for Donald Trump, and she's been sucking up to Donald Trump in a big way recently. But he's got to have an excuse to get rid of Mike Pence. And so if, 2 months from now, you've got a couple 100,000 coronavirus cases in the United States and we're overwhelmed, that gives Trump an opportunity to fire Pence, put an actual doctor in charge of the health emergency and bring Nikki Haley into his administration and then run for re-election on a Trump-Haley ticket. I think that's an entirely plausible scenario. So I don't disagree with you. I think that it's, and in fact, I think that probably this is the reason why Jared Kushner is not the one that he put in charge of it. You know, he puts Jared Kushner in charge of everything that's big. But Kushner probably took one look at this and said, no way you're going to put my name on that, and stick Mike Pence with it. So what do you think, Eileen?
I agree with you. He's looking for a scapegoat. You know, he's never going to admit if he did something wrong, and anything that seems to require maybe a possibility of going wrong, he's putting it off on somebody else.
You bet.
And who better?
Yep, and he's been doing it his whole life. Eileen, thank you. Well said. Rick in Bellingham, Washington. Hey, Rick, what's up?
Yes, Tom, I was in Paris in November of this year. I caught an upper respiratory condition and had trouble catching my breath. I was 2 days before flying back and didn't want to experience that on an airplane. I walked into a French pharmacy, explained it to the pharmacist. She gave me an inhaler for €6.
About $7 US.
Yes. So Are Americans stupid?
Yes. Well, we're not stupid. We're misinformed and malinformed, and we are the victims of an enormous amount of very expensive corporate propaganda, and our politicians are being bought and sold by these same companies, and it's just that simple. So,
amen.
Yeah. Okay. Thanks a lot for the call, Philip in Boston. Hey, Philip, what's up?
Hey, Tom. Yeah. So I heard you say that about the Bloomberg canvassers who are actually Bernie supporters.
Yeah, Nate was telling the story off Facebook, and he was telling me the story. Yeah.
Yeah, same situation. This Saturday, I was going for a run. I had my Bernie shirt on, and I ran into these two guys. We live in Roxbury, a traditionally Black and Hispanic neighborhood in Boston. Mm-hmm. And these two guys were canvassing, one for Bloomberg, one for Bernie. And the Bernie guy was an older Black man. He seemed really, really into it. And the Bloomberg kid was a younger kid, and he, we were sort of discussing it, and he was like, you know what, I'm actually a Bernie guy. Like, I love Bernie, but I'm unemployed. I have, I'm desperate for a job, and I'm getting paid to do this, so I'm out here canvassing for Bloomberg. It was wild, So I'm like, I kind of gave him a hard time. I was like, I don't know, man. That kind of seems but he's like, I don't have a job. I need a job,
Yeah, $2,500 a month is nothing to sneeze at.
Yeah, it's crazy, but I was just like, if anything else sums up this election cycle, I think that's it.
It's the perfect story.
Anyway, I just wanted to share that. It was crazy.
It is the absolute perfect story. Philip, thanks for confirming that. When Nate told me, I thought, really, is this like one of those vanishing hitchhiker stories? One of these apocryphal stories?
I bet it's happening all over the place.
I'll bet you're absolutely right. Thanks a lot for the call, Mike in Medina, Illinois. Medina, Illinois. Hey, Mike. Last minute of the show. What's up? Medina, thank you.
Yeah, real quick, Tom, I just wanted to make one point that I wish the Democrats would bring up on the debate stage and hammer Donald Trump with this. Remember that job killing that was going to destroy the economy, Obamacare, that was just so horrible?
Right.
We've been averaging, ever since it passed in March of 2010, we have averaged 204,000 jobs per month. And the last 4 years of Obama's presidency, it was 217,000 jobs a month. Now, since then, my statistics are from Department of Economic Research and from PolitiFact. Mm-hmm. I double-checked it. Since Trump took over, we've dropped down to 189,000 per month on average. Now, that's as of September.
Yeah, Trump is doing nowhere near as well as Obama did in his last term, his last 4 years. He's just been riding the Obama wave, and now it's starting to collapse under its own weight, because of the Trump tax cuts, and of course the Wuhan virus isn't helping. But this bull market was ready for an end. We've been talking about this for 2 years on this show, Richard Wolff every week. Anyhow, we'll be back tomorrow. Anything Goes Friday. Looking forward to the conversation with you. And the Dow is down 700 points right now. We'll see where that goes. In the meantime, don't forget, democracy is not a spectator sport. It needs you. We need you. So get out there, get active, tag You're It, and share with your friends how to find progressive media. Tell somebody today. Thank you.
You've been listening to Thom Hartmann. For audio and video archives, visit thomhartmann.com.